So I think we should probably start with a roll call. I've been informed that a number of members will be unable to make it to the meeting tonight, so we'll start off with a roll call. I'd ask that if you're going to speak, please turn on your microphone. The gentleman in the back has indicated in the last meeting he's had difficulty hearing the remarks because people are not using their mic. So if you choose to make a remark, please make sure you're in front of a microphone and it is activated. So with that being said, Pat Katina.
I don't look like him, but Bethany Hallam here.
For Pat Katina. Richard Fitzgerald.
Steve Polarski for Rich Fitzgerald.
Terry Klein.
Present.
Judge Lazara. Gail Moss. Acting County Controller Tracy Royston.
Ryan Herbenko for Acting Controller Tracy Royston.
I don't think you turned your mic on, my friend.
I didn't either, sir.
One more time.
Ryan Herbenko for Acting Controller Royston.
Sheriff Kevin Krause. And Abbas Camara. My apologies. All right, with that being said, we are going to, you want to go virtual? We'll call the meeting to order. I'd just like to remind everyone of the rules. So anyone wishing to address the board must sign up in advance of the meeting. I have the sign-up sheet here. And profanity and yelling will not be tolerated. Anyone using profanity or anyone who is yelling will be removed from the meeting. If you're unable to do this, I am kindly asking that you leave at this time. Everyone will be treated with dignity and respect. Thank you for your consideration. Also, we have 3 people that have signed up. I'd ask that you limit your remarks to under 10 minutes. We have a very full agenda and we have a number of public comments. And to do everything we need to do, we'd ask that you just limit your remarks. I don't want to, turn this into the Apollo Theater and kind of shut off anyone's mic or pull you off from in front of the microphone. But we do have to keep the meeting moving. So I ask that you limit your remarks to at least 8 to 10 minutes maximum if possible. So hopefully everyone will be able to respect that wish or requirement. So let the record reflect that Gail Moss has entered the room, as well as, I know, I'm trying to get his title. Chief Deputy Sheriff, Mr. Kearney, on behalf of Kevin Cross. So with that, we will have a presentation by Amy Kroll. Good evening.
You're getting one extra.
I was just about to say, I have Amy Kroll and Jen from DHS.
Yeah.
Good evening to you as well.
Good evening. Well, I guess you did our introductions for us. We're just here tonight to share a little bit about the reopening of some of the reentry services and other programming in the jail. I'm here on behalf of DHS. We support Amy and her team and hold the contracts for many of the services that are provided in the jail that Amy and her team oversee, specifically the reentry programming services. So I was going to start with just an overview of the reentry program, the services and the contracts that DHS supports. I think you're all aware that during COVID, these services were substantially modified. So for the past 2 years, they were operating in a very different way than they historically did due to the COVID mitigation protocols. But we're happy to share, and I think some of this was shared in some recent press releases and in past meetings too, that the services have begun to resume sort of more normal operations in the past couple weeks. So Amy's going to talk a little bit about that. But again, just in terms of an overview of what these services are, the reentry program was designed to serve really a subset of individuals in the jail, those at higher risk of recidivating, and those who are in the jail for long enough to complete the courses and the classes and the groups that with fidelity to the model without us sort of inadvertently keeping folks longer than they need to be there. So we have historically focused on a subset of individuals who are primarily the sentenced population who would be there long enough to complete some of these programs. So those individuals who are targeted for the reentry program, they receive service coordination support both pre-release and after release for a number of months, as well as a designated reentry probation officer. And then the reentry program participants are also prioritized for these core services that DHS holds the contracts for. So those supports are a cognitive behavioral change program called Thinking for a Change, as well as a follow-up course that is referred in the jail to as SAGE, or sometimes aftercare, and for individuals who have already completed this initial Thinking for a Change program. We work with Mercy, Pittsburgh Mercy, to provide that course and service. Pittsburgh Mercy also offers family support services, so they offer parenting classes and relationship classes. And then DHS also holds a contract with the AIU around a number of educational courses that are offered to individuals in the jail. And just to be clear, all of these courses, though the reentry program participants are prioritized for enrollment, the courses are available to other individuals as well. So Amy could speak a little bit about how now, as things are reopening, people are being enrolled in classes, which is a little different than usual, but better than before. And just to be clear, historically, the services have been offered in-person, facilitated group, offered in sort of a facilitated group session setting in the jail's reentry center. And then reentry program participants have also historically resided on a dedicated structured housing unit where they have had additional opportunities for some engagement and support by virtue of being together on that housing unit. And I just wanted to share, folks may know this from other discussions, but this core reentry program underwent a really extensive evaluation. Now, many years ago, the evaluation was conducted by the Urban Institute in 2014 and showed really significant results in terms of reduced recidivism for individuals who participated. And so, again, obviously, some of our services really did suffer an impact from the way they had to be modified during COVID, but I think we are collectively really looking forward to both getting back to fidelity to the program model in a way that sort of reflects the way things operated when the evaluation showed such strong results. And then also, of course, knowing things change, the jail population changes, individuals' needs change, and so always looking to identify areas for improvement and new services that can be offered both pre and post release. So I also just want to mention there are some other programs and services at the jail which you all have heard about in the past that DHS doesn't hold the contracts for. I think Amy might talk a little bit about some of those as well. And how those have started to reopen. And just to put a fine point on this, Amy is the extremely dedicated, committed person in the jail who is really works miracles and makes things happen for individuals in the jail despite the circumstances, despite the ever-changing circumstances, and really has carried a lot of this on her shoulders as through COVID and now into reopening. The logistics and the operations and all of the considerations have been she has been moving them forward on behalf of the folks in the jail who are, I think, extremely eager to be back together in person, getting the support that they need and deserve. So I'm going to turn it over to Amy to talk a little bit about sort of the operational changes that are underway now and how services are being offered.
Okay, so let me tell you all the exciting news. On March 22nd, the Reentry Center reopened to in-person classes. And on March 2nd, we had, Mercy Inn, the instructors, all vaccinated, began offering Thinking for Change, Parenting and Relationship, 5 days a week, 3 times a day, which, if you think about it, is actually an increase before what we were doing pre-COVID. Pre-COVID days, we were actually offering these courses only 3 times a week and only twice a day. So we have actually increased our classes and increased our numbers. So on that day, we actually had 68 individuals come down to start Thinking for a Change. We had 66 individuals come down to our family support program. But let me explain. These courses last for 6 weeks. You are having your course twice a week. And that allowed us to bring down 3 pods a day. In order to keep COVID at bay, we wanted to keep the pods together. So we would go to the pods, have individuals sign up for the classes, and then on their given day, either Monday and Wednesday or Tuesday and Thursday, again, Friday for the females, we would have the individuals come down as a pod and then split off into their respective classrooms. This also included education. So we were doing pre-GED, GED, and again, because of slowly getting up to speed, and then our computer literacy program. As I will explain as we head into phase 2, then more classes, will be offered. But it was exciting to see people in person. And all the chairs were socially distanced. Everybody had to wear their mask. Again, safety is so important. And this way, we were able to open up to in person. Also, just recently, April 4th, our Batters Intervention Program began in the Reentry Center also. So, the Reentry Center opened on the 22nd. We started classes, Thinking for Change, Batters Intervention, and Parenting. On the 28th, we added AIU and Education, which is GED, pre-GED, and computer literacy. And then on the 8th, we added in the Reentry Center, Batters Intervention, which again, a lot of our judges want those individuals in that program. So we were, and that specific program, Batters Intervention, is a class that is offered by Wesley Family Services in the jail. And then as we also began to work with Hope. Hope is now getting all their volunteers and instructors clearances to come back in the jail. And again, all our instructors from all our programs are vaccinated. So we are collecting copies of cards. So we're trying to get Hope, the Hope Pod, up and running again by the individuals are on the pod. 2C is our Hope Pod, and those individuals have come to that pod and they're living together. Reentry is now 3A, and that's the Reentry and Education Pod. So we again have started to slowly bring things on. So our hope is that as we go into the next phase, we will be bringing back our SAGE program. The SAGE program is like the graduate program of Thinking for a Change. Basically, those individuals in the SAGE program practice thinking for a change. So it is more, in that class, you think about given situations, whether from your past or your future, on how you would handle it different. So again, on all good cognitive behavioral modification, you're going to practice what you're trying to do. You know, we're also hoping to bring back or start, as we never had in the jail, but we have heard from a lot of individuals that have attended classes and from others that anger management is very much a class that is wanted in the jail. So we are looking for curriculum, evidence-based curriculum to start that. But again, you know, both DHS and, you know, the jail, we welcome your ideas. If you have heard of other, you know, programming that you think would really benefit the clients, then we would love to look at it. We will be bringing back the pre-apprenticeship program and a job readiness program too. But, you know, again, with COVID, we want to do things slow because safety is so important and because we are putting a lot of individuals in a smaller area in classrooms. So we always want to follow the COVID protocol. So that's it in a nutshell. It's going very well. Since the 22nd, the volume of people wanting to talk and to discuss, it's exciting.
Thank you.
Thank you very much. So I did have one question, if I might ask. What are the requirements for participating in these various programs? I understand that the batterers intervention program is typically court ordered, whether it's at the magisterial district court level or court of common pleas. But what are the requirements for participating in these different programs? And then the second question I had is, do you currently have a waiting list? You know, how does that work? How does one get into the program? Okay. And do you have a waiting list? Thank you.
Yes. To get into the program, the inmate uses the tablet and writes a request and or does it on paper and says, I wish to be in the reentry, I wish to be in Thinking for a Change or parenting or relationship or GED. For GED, they are going to test you to see what level you enter. For any of our classes, besides parenting, you are just welcomed in the class. You don't have to have a GED or a prerequisite course. But for parenting, we do ask that you are a parent or going to be a parent, only because we want to set those seats for higher priority for those individuals. A lot of times we get CYF recommendations and or a CYF caseworker calls and says this person needs parenting. So of course that person would go, you know, into the class more quickly than somebody, you know, that want. And waiting lists, yeah, most of them are over 50 or 60 participant long. Because we run them every 6 weeks, they're closed cohorts, because we want that healthy discussion. We're constantly putting new people in every 6 weeks.
Any questions? Yes.
Yeah. Hi. Thank you for that information. I have 2 questions about the things you were talking about. My first question is, so it was my understanding from previous times that we've talked about the programming at the jail that it wasn't open to people who were not serving sentences. And you said that now it is, even if you're awaiting trial or you're in there for detainer, you're eligible for the classes.
Correct.
What would you say the breakdown is, though? Because you have no idea when those people are going to be released. So are you giving like some sort of priority to people who are serving sentences? And if not, what is the breakdown? Would you say it's 80% of the participants are people who are serving sentences, or what would you say that is?
No, actually it's opposite. When we looked the other day, because there aren't that many people in the jail serving sentences, our numbers of sentenced inmates has gone down. So it's around, what do you think the last time we looked?
I don't recall what the numbers are. I would say that because of the shifting sort of population in the jail, we are finding ourselves needing to look again at whether we have the right sort of eligibility criteria and, frankly, program design in place. Some of these evidence-based models that we have put in place that work well, have been researched to specifically for a subset of the population. And so these are all things that as we reopen, we're really trying to revisit and understand what we need to put in place differently based on the changing population and the like. I think we probably could look at the current breakdown.
Yeah.
I'm not sure that it would be reflective. I mean, especially because of the way that
They're coming down by pods. Yeah.
Right, because that's what I was wondering, because we know the overwhelming majority of the population are not serving sentences. So do you even know if it's like in proportion to the percentage of people who are serving in the percentage of participation in the class?
Take a look at it
Yeah.
and get back to you on
That would be very helpful. I appreciate that. And then my second thing is, just because it seems like Yins are the one who are like making all the stuff happen and all the programming in the jail, have you been working with to make sure that folks who have their preliminary arraignments have pretrial, folks from pretrial and the public defender's office representing them? Is that anything that you've been doing in your service coordination?
So that falls like outside of the
Right,
scope
yeah.
of
Okay.
what
What we
Amy does,
do.
but that's certainly work that the county partners have focused on, and there was an impact during COVID. I'm not sure who in the room can, if anyone in the room can speak to that, but I believe that there is the pretrial services and public defenders are planning soon to be back in the jail.
Okay.
I don't know precisely the date, but I know that that's been a priority for,
So not yet, but coming.
that's my and maybe the board might be.
Oh, I'll ask them later too. Don't worry, but thank you both so much. Thank you.
Yes, Terry Klein, yes.
Question maybe for you, Jen. Has DHS collected any information regarding recidivism during COVID when these programs were understandably put on hiatus?
Yes. I don't have it at my fingertips. We did a published report that is on the Allegheny Analytics website that looked, I think, generally across the jail population at recidivism during COVID. So you could find that on the website, I believe. We have done for like, planning purposes, some internal looks at and we regularly look at recidivism for reentry program participants. I can't off the top of my head recall what that looked like versus other moments in time. But that is always a metric that we are concerned about in addition to others.
Any additional questions? I just wanted to make one comment. Just having, worked in the public defender's office and also as a defense attorney, I just wanted to state how important your services are, because I know a lot of times people have charges and they're incarcerated, and historically they were unable to do batterers intervention or parenting classes due to their incarceration. So it's kind of like a catch-22. You have to do these requirements to get out of jail, but you can't do the requirements while you're in jail. Or to resolve your matter, you have to do the requirements, but you can't do them because you're in jail, and they weren't, historically, those services weren't offered. So it's a game changer to be able to comply with those requirements while, in jail, because in the past, that was not an option. So I just want to commend you for your efforts, and I know that it's significant because there was no way to do that in the past, and it ultimately would require a judge to release a person with the hopes that they would follow through, or detain them and they couldn't follow through. So it's just noteworthy. So I wanted to say that.
Well, and it's exciting because they partner with the community providers who teach batterers intervention.
Right.
So that if I come in the jail, I started in the community, we can find out how many classes you completed, and then we can start you right at the same point that, so you don't have to start from the beginning and go
Right.
through all of it again. We're able to say, oh, you completed 4 classes. Okay, well, let's start there.
So,
move on.
but on the converse, if a person were released prior to finishing their classes? Is there a mechanism in place
Yes.
where they can have like continuity of care?
Yes, we
in the
tell them
community?
what group they got to go to, and then we talk to that provider and say they completed, 16 classes in the jail, and this is how many more they need to complete their 24.
Okay, is that as far, I know that's with batterers intervention, but is that also with the GED program and the other?
GED, you can go to the waterfront for AIU.
Okay, all right.
So we're trying to make sure that there's that bridge there.
It's important. I think that's important. So thank you. Thank you for your efforts, and thank you for presenting. Thank you. All right. We are now on to the community corrections reports. We'll hear from Passages to Recovery.
Yes, my name is Kevin Cordzen with Passages to Recovery, and I am pleased to report today that Passages to Recovery is preparing to move our residents from our Passages Pittsburgh site on Fifth Avenue to our facility in West Homestead. This has been a long-term goal for us to enable us to consolidate, strengthen, and grow our organization. We own the property in West Homestead, and our vision is to fully develop this site to expand our drug and alcohol treatment services and meet growing needs. We've been working closely with Warden Harper and Connie Clark to ensure the transition goes smoothly, and we are planning on moving staff and residents later this month.
Ms. Hallam?
Yeah, thank you for that report. I just have a question. If this was a long-term plan, long-term goal, why is this the first that we have heard about it? Moving, closing, whatever it is.
Well, I think it's been a long-term goal of ours. It's not something that we've kind of advertised simply because the development, trying to develop the site requires funding and money and planning. So it's something that we've been kind of kicking around for a while.
But when did the actual, when did you know you had the funding? When did you start developing the facility? I mean, it couldn't have just happened since the last jail board meeting, right?
Actually, those things aren't in place, but that is part of our intention, is to move in that direction.
Okay, and what is the date that's?
Tentatively, we're looking at later this month to be able to do that. We have been kind of consolidating things within the at West Homestead, working out how we're going to do that, where we're going to fit staff, things like counseling space, group room space, working those things out. So that's been going on all along.
Okay, thank you very much.
Any additional questions? I did have one question. As a result of the move, excuse me, have you found that it has increased your capacity for treating incarcerated individuals, offering more services as a result of the move, or has it pretty much status quo, or has it limited your ability to provide those services?
Well, I think ultimately what it's going to do is it's going to increase our ability to provide services and the quality of services, because we haven't, even though we're consolidating two programs, we're not letting go of any staff.
Okay.
So from that standpoint, typically in a residential drug and alcohol treatment program, you have a 1 to 8 therapist ratio. We will far exceed that. So that will enable us to provide more services, be more responsive to clients, provide more group, reduce numbers in groups. So
how many people will you be able to house, and how long is your program?
the site enables us to house 52 clients.
Okay.
So that would be a mix of residential and what we call TLF, which is transitional living. There is no set kind of time frame, but typically we run 3 to 4 months for residential treatment.
Are there, can it be longer than 4 months?
It can, because it's really based on one of the things that happened in Pennsylvania with what's called ASAM realignment, to where the state has kind of moved in a direction with ASAM is a way to identify level of care and whether someone meets the level of care. that insurance companies require agencies to use. So the whole thing with ASAM is that it doesn't have a set period of time, but it's based on what the individual's need is. So they really even shied away. Years ago it was you had long-term and short-term, and they've shied away from that completely to where it's just whatever that person's need is, and we're able to justify continuing the need, then we're able to continue to get authorization for service.
And last question, I promise. Is there a requirement that a person be sentenced there? Can a person be there pre-trial as a condition of bond? Can they be there, have their detainer transferred, or do they need to be sentenced?
We have a mix. We have folks that are sentenced. We have folks that are diversion out of jail. We have folks that are diversion off the street. We have people that are self-referred.
I'm sorry?
Self-referred.
Self-referred. That was my last question. Thank you very much. Thank you for your time.
All right.
Any other questions? All right, thank you, sir. We will now hear a report from the Renewal Center.
Good afternoon, Adam Zach reporting for the Renewal Center. I don't have much to report this month. We're in the process of getting ready for our ACA audit, that being the American Correctional Association. That will take place on Monday and Tuesday next week. We're just making sure our facilities, files, and paperwork are all audit ready. We've had high marks in this audit in the past, and we're looking forward to continuing that record. And that's all I have.
Any questions? Yes, Ms. Allen.
Yeah, I just want to ask that after that audit happens, if you could forward the findings over to the board.
Yes.
Thank you very much.
I have one question. Is that a yearly audit, or is how often do you have to undergo that audit?
It's every 3 years, I believe.
Every 3 years?
But because of the pandemic, after this one, it's going to be 2 years from now.
Okay. Thank you very much. Any other questions? Thank you, sir.
Thank you.
We'll now hear from electronic monitoring.
Good evening, everyone.
Good evening.
Sorry. My name is Frank Shear. I'm the Director of Adult Probation. Just a few highlights of our report for the month. The active population at the beginning of the month was 621 individuals. During the month, we had 32 successful completions, as well as 6 cases that were returned to the jail for violations. There's also a list of the types of sentences folks are serving while under electronic monitoring for the month. I didn't know, are there any questions related to the report?
Any questions?
Okay, if I could add 2 things, Your Honor.
Sure.
One, Ms. Batterton mentioned the reentry program. I don't know if you heard or not, but she had mentioned that we have a partnership with they have a partnership with adult probation. So we actually have probation officers that work in the jail as part of reentry. I have an entire unit devoted to reentry. So embedded is probably not the right word, but we have officers that actually have offices, and thanks to the warden and his staff for providing that in the jail. So my staff starts actually working with folks a few months prior to the potential release date. So I believe, Amy, we use the midway point on a parole, for example, at 11.5 to 23 month. We'll start working with someone at the 8th or 9th month. And again, to have that continuity. So when that person is eventually released, they already have a probation officer assigned. There's already a plan in place. We already know, as you had mentioned, if they're on number 4 of their BIP classes, we know their next one is number 5 in the community. So it's a pretty comprehensive program that we're very proud of. And just a public comment, these are 2 awesome people who do yeoman's work behind the scenes. So I'm actually super excited that we are partnered with this group. So it's a pretty successful group. Unfortunately, due to COVID, we haven't been back in the jail, but we are starting next week. So I'm proud of that.
So is it fair to say then those efforts are intended to increase the likelihood for success while on probation, because instead of waiting for someone to get out of jail and then get coordinated with services and a probation officer, you're actually setting those forces into motion prior to their release, which should benefits down the road in terms of compliance.
Correct, correct.
And I think that's the goal, right?
That's obviously the main goal of that. Yeah, again, traditionally, someone gets paroled, we get paperwork a few days, a few weeks later, if that. We find them in the community, and sometimes we're a month, two into it before we even start. And then everything they may have accomplished in the jail, sometimes, you know, it would backtrack a bit. So this gives us, our officers should be knocking on the door the very next day of a parole. So that's the continuity of the program.
So you're only dealing with people who have been sentenced and are serving a sentence?
No, anyone that's in the reentry program that will be looking at a either a parole, a local parole, or a tail probation that they'll have. So again, folks that are in there on a detainer, those detainers are from us.
Sure.
So obviously, they're going to get out at some point. So again, we'll start working with that group as well. So,
Ms. Hallam?
Yeah, you just made me think of a question.
Okay.
So I think I had asked you in the past, has there been any work towards like waiving the fees for electronic monitoring for people who can't afford it?
Short answer is no on that. We do have a pretty thorough policy in place that we base it on income. It's as low as $1 a day, and it goes up based on income. But to clear, you know, some of the community myths or whatever, we will not turn anyone down or take anyone off of electronic monitoring due to a payment issue. If they finish the program without paying, technically it could be considered a violation, but we look at in a whole. If someone doesn't have the ability to pay, they don't have the ability to pay. So that will stay as a bill, so to speak. And if they ever do come back on electronic monitoring, they're asked to pay that. So.
Oh, yeah, I've just heard from families who have, talked of the burden of the cost of electronic monitoring, and I'm just trying to figure out a way, like, who we could work with to set up some sort of county program that funds electronic monitoring, or if folks are eligible for a public defender based off income, that all of their fees for electronic monitoring are waived. I mean, is that something that you would be open to working with?
I think it would be something open to talk about. Obviously, that's not my decision, so I don't want to commit to that, but I mean, it makes sense to me.
Okay, so there's not one of these, I know it's probably not the same number anymore, but not one person pays nothing?
No.
Okay.
I preface, not pays.
Right.
Bill.
Is assessed a fee
Yes.
of $0. Okay, thank you very much.
Yes, you're welcome. And then, Your Honor, if I may, I have one question. So some of the board members may recall we're required to have what used to be called an intermediate punishment plan every year. And if you remember me showing up once a year before I started coming regularly, I would present the plan. It's a requirement of our intermediate punishment grant that we received from PCCD. So if possible, I need to request being placed on the agenda for next month. And what I would like to do, if the board is fine, is send the plan ahead of time. It's pretty lengthy, and then obviously I'll be here to answer any questions, if that's okay. And again, it's a statute that we're required to have, and it's required to be approved by the board. So I'd also need a vote, if possible.
Okay.
Can I ask a question about that?
Sure.
Yeah, so what does you said it's a grant, right, that you have to do the plan for?
Well, every year we receive a PCCD grant. It previously called our intermediate punishment grant. Statute changed intermediate punishment recently to probation with restrictive conditions, which include electronic monitoring.
Okay.
How, why, I don't know.
Does it fund the whole, it doesn't fund the whole department, so what specifically are those grant funds used for?
Salaries for officers that work in drug court and DUI court. Some treatment folks that are assigned to those, and it pays for treatment for folks in those programs.
And could those funds be used to supplement the fees associated with electronic monitoring?
They're not permitted.
Okay, thank you.
Yep.
Any additional questions?
All right,
All right, thank you, sir. Thank you very much. All right, review of the minutes from the previous board meeting, March 2nd, 2022. Hopefully, everyone's had an opportunity to review the minutes. Mr. Banco, do you have something?
No, just motion to approve.
Second.
All in favor?
Aye.
Any opposed? All right, the motion shall pass. All right, old business. I apologize on the agenda. There was a miscommunication in my office, so I want to apologize. There were a number of things that were supposed to be removed from the agenda for today, namely the Suicide Prevention Subcommittee. While there are a few people here from that subcommittee, I thought it would be wise to hear from all of the members, and there are a number of members who are on that subcommittee and are not present today. So we were going to table that discussion for the next meeting when everyone could be here. However, there will be an update from Warden Harper and Deputy Warden Beeson regarding some of the issues related to suicide prevention. So I don't know which of you gentlemen intend to go first.
Good afternoon, Board. I just want to report to the Board that the Allegheny County Jail decided to call the National Commission for Correctional Health Care back to our facility to review our corrective measures pertaining to their audit, pertaining to their suicide review that they did a couple of years ago. That was one of the things that the Board had asked us to do. So we are going to seek them coming back to our facility to look at what we did for the recommendations that they made for the facility.
Yes, Ms. Allen.
I appreciate you inviting them back. My question is, what is the update? I know like the last time we talked about it, all of the recommendations weren't in place, but you were working on them. Are they now all completed? Is that why you're inviting them back now?
If I may, I think Deputy Beeson was going
Is going to talk about that?
Right. So a little bit previous.
Perfect.
Thank you, Your Honor. Good afternoon, Board. My update, I can report that 7 of the 10 suicide-resistant cells that are slated for install are complete. The 3 remaining cells are all in the intake department. So that's the update on the recommendations of the report.
Yes, Ms. Allen.
To your question, Ms. Hallam, everything that was included in that report that we could do minus the physical plant changes have been completed, minus the 3 cells that I just reported on.
And so what is the plan for the physical changes that they recommended?
There is no plan for that. We can't change the makeup, the physical makeup of the jail.
Without a new building?
Pretty much, yes.
Okay. So what do you plan to tell them? Like, hey, we're not going to do this. How do you plan to respond to them? Just say, I know you recommended this, but we're not going to do it?
I would say it a little more eloquently than that.
Yeah, but basically that.
There's nothing we can do to be in compliance with certain recommendations.
Okay, thank you very
The
much.
report in front of me, I can't speak to what those are.
Okay, and that revisit, is that happening after the 3 intake cells are complete, or are you doing that now?
We don't have it scheduled right now.
Don't have a schedule. Thank you.
Yep.
Anything else, Warden Harper, regarding the?
Nothing else pertaining to the suicide review, sir.
Okay. Regarding the GTO update on the hours inmates have access to tablets?
Your Honor, the incarcerated individuals are allowed to have their tablets from 8 a.m. to 8 p.m.
Is that what, you had a question? Ms. Hallam?
Yeah, I have a question about that. So is anyone have more restrictive hours on the tablet, or does everyone who is allowed to have a tablet from 8 a.m. till 8 p.m.?
Everyone can have the tablets from 8 a.m. to 8 p.m. unless a medical provider deemed that it's unsafe for them to have that.
So no one's sharing tablets and only getting half that time. Everyone who has not been deemed unsafe to have them has them for 12 hours every single day.
Right now, yes.
Okay, and in the past, has that been the case?
We did have that issue in the past, yes, ma'am.
And what was the reasoning for that?
Supply and demand. COVID has stopped a lot of stuff from being able to come in a timely manner. So I think the world is experiencing supply and demand.
I'm sure it is, but we're not the oversight board of the world. You know that. We're the oversight board of the jail.
Well, anything that come in not in a timely manner is because of the supply and demand that everyone is facing.
Like broken tablets weren't being replaced fast enough because the population's gone down, right? So we should have had enough tablets when we ordered them. The population's now lower than it was when the tablets were ordered.
But you got to realize that incarcerated individuals were breaking them just as quick as they were getting them. So
That's what I was
that
asking.
also contributed to us not having enough.
Okay, but right now, do you have a total count on how many functioning tablets you have?
I don't have it in front of me now.
Okay, if you could give that to us, just so we can kind of keep track and make sure that the supply is staying on track. Thank you very much.
Any additional questions regarding that issue? All right. Warden, I'm sorry, not Warden, but we also had planned to hear from Judge Lazera regarding an update, again, regarding the Pitt School of Social Work. And there have been some developments on that front, but we also wanted to hear from Erin Dalton, who is unable to attend this meeting because she is in Atlanta, and Judge Lazera is unable to attend as well. So again, that will be another item that we will table until next meeting, and we will discuss that in old business. So the
You don't want me to discuss it?
well, I think the concern was that Erin Dalton was the one who would be able to speak as to those issues, along with Judge Lazera, along with all the other members. So,
It wasn't Judge Lazera not being here as much as it was Erin Dalton.
and it was Erin Dalton as well. So I think the consensus. Yeah, but for her to give an update and then have to go over it again next meeting with Erin Dalton, I just thought it would be wise to just wait until Erin Dalton can be here and we can address all of the issues and we can address it at one time. Is that okay with everyone?
I want to hear about it.
My opinion would be that the public should know the status, even if we don't have all
Give the
the
public the status.
So I was in contact with Dean Farmer, who said previously that a draft would be ready the end of March, and Ms. Dalton received a draft of the report and an executive summary. And Ms. Dalton has scheduled a meeting to discuss the results on April 29th. After that meeting, Ms. Dalton will compile comments for Dean Farmer's review and consideration. This will give Dean Farmer an opportunity to make any modifications to the report. Within this time frame, the committee is expected to get a draft of the report the week of May 8th or 16th.
Thank you very much. So, and again, we will address that further when Judge Lazera, Erin Dalton, and everyone can be present to discuss it as a group. We'll now move on to public comments.
Judge Elsie?
Yes.
Can we get an update on the other two things under it?
Update on the contract.
The liaison.
Oh, I'm sorry, forgive me. Update on contract with the PA Prison Society. I believe, was that Mr. Pilarski?
I had the liaison, yeah.
Okay.
So as an update on the jail liaison position, some of the members of the subcommittee, we had a conference call, I want to say March 24th, 25th, whatever that Thursday was. We met, I had worked on editing and refining some stuff. I sent that back out to everybody, I believe, Tuesday this week. So if I don't hear back from, I heard back from Ms. Klein. I think we said when we had met, we tried to give everybody 48, maybe 72 hours review. We want to get that back out. So that'll be tomorrow. If I don't have it back by tomorrow, we'll send our final draft with its edits back to the Prison Society, and we can go from there. Is that a pretty much fair assessment of what we talked about at our meeting? So we're moving forward. We're moving. There are some things in there that we like, and there are some things that the board has some issues with that we need to address with the Prison Society. So.
All right, thank you. Update
I have a question there.
Oh, I'm sorry. Forgive me, I didn't see you. Sorry.
Okay, that's all right. When was who was who was sent the draft, or when was it? I heard you say.
Yeah, I said the draft Tuesday, but I think it was just everybody who was at there, Ms. Hallam, Ms. Klein, Judge
Just the
Lazera.
people that worked on it.
Yeah.
Okay.
Did I copy you, Judge House? I don't even remember, to be honest with you.
I believe you did, no.
Sure, so no. I don't have a problem, we could send it to the other members, that's not an issue.
I was going to say, Steve, if I could alley-oop here, like,
Yeah.
we've been going back and forth a million times, it feels like,
Yeah.
trying, between the two groups, trying to get something that's like our final last deal
Fair
before it comes to,
statement, yeah.
yeah, exactly. So when we have that, I think the intention was to then loop in the full board. We can all talk about it, we can plan, and then we can move forward to voting.
I think when we send it to the prison side, we'll send it to the full board, that way everyone has it at the same time.
Any other questions regarding that? My apologies, Ms. Moss. Update on compensation for work performed by inmates at the jail. Does anyone have an update?
I hope the controller's office does.
We do not.
Do you think that Ian's could have that by the next meeting?
We'll certainly try.
Yeah, so just, to update everyone else in case you've kind of lost it, I know we've been talking about this for a while. We're looking into funding to paying a wage to the workers who are incarcerated in the jail. They are performing a service for the jail that we don't have to pay for pay someone else to do because they're doing it, and they should be compensated for their work. So we had voted at a previous meeting for the controller's office to look into what that cost would be based off of the number of workers and how much, we'd pay them per hour and how many hours they're working per week. So just an update on that.
All right.
Sure, we could have that.
All right, thank you. On to public comments. We have 3 people that have signed up. Again, we'd ask that you limit your remarks to under 10 minutes. We really don't want to cut anyone off, but we just ask that you be brief as possible. So first on the list is Mr. Kostinowicz. Mr. Kostinowicz. And I wanted to say I had the pleasure of meeting with Mr. Kostinowicz following the last meeting, and he had some significant information to share and some insight as to some of the issues that he feels are affecting the jail. And he thought it would be wise to bring it to the board's attention. He also indicated that he would be sharing some of those insights this evening. So, Mr. Kostinowicz.
Hi, good afternoon.
Good afternoon.
Yeah, the first thing I want to talk about is the jail oversight board's inspection reports being available to the public. Okay? The statute governing the authority of the jail oversight board states the following. After each inspection, the board shall prepare a written report setting forth its findings and determinations, which shall be available for public inspection. The board has been violating this part of the statute since the board's creation in 2011. It has never made its inspections public. My question is, why has the board been avoiding this statutory responsibility for so many years? The public has a right to know. So instead of creating barriers for the public's access to information, can the board now seize this opportunity and build a bridge between themselves and the public and grant access? This bridge will help build a public's understanding and perception that the board can provide true insight of the jail. So my question is, when can we expect the Jail Oversight Board to fully comply with this part of the statute in which the inspection reports will, quote, be available for public inspection? Do you want me to go on to my next part, or can we talk about that?
I would say that this really is public comments. They're not questions per se. We have discussed that. I think if there were a response, briefly, I would just say, it's my understanding, and I just got here, but it's my understanding that parties have opted to share their findings from those visits and those inspections by way of a statement during the meeting. I understand your position. We talked. You feel that that is not in compliance with the statute. I think that's definitely a discussion that the board needs to have, but we heard your comment. I've made a note. So I'd ask that you move on to your next comment, please.
Okay. Well, my reading of the statute is, which shall be available for public inspection. So I'm assuming what that means is that we would actually see the reports. Okay, that's my understanding.
I understand your position.
Okay,
absolutely.
All right. So, so is somebody going to get back to me, or where do we want to leave that at this point?
As a board, we will address that.
Okay, all right.
There will be a follow-up.
Okay, all right. The next area I wanted to talk about was the Allegheny County Jail's compliance with the NCCHC recommendations on suicide prevention. With the statement the warden had just made about NCCHC coming back to the jail, that helps with my concern about the staffing crisis affecting the compliance with these recommendations. So it really involves the service delivery, not the physical changes that have occurred at the jail, which is great. But the question is really, how is the service delivery with the staffing crisis we're experiencing, how is the jail going to be complying with, the the NCCHC recommendations? That's my question. But now it seems like that question is going to be answered at a point in time. So I'll move on to my third area that I want to talk about, which is the staffing issue, the staffing crisis. According to last month's ACJ Health Care Staff vacancy list, there were 53 vacancies. So that included 6 licensed practical nurses, 8 medical assistants, 4 mental health specialists, 9 registered nurses, and 4 substance abuse counselors. Now, according to the same monthly ACJ healthcare staff vacancy data, there were 37 vacancies on August 31st of 2019. The same month that NCCHC found, quote, staffing challenges at ACJ. The staff vacancy for healthcare staff has jumped 16 vacancies since August of 2019. Adding the 50 vacancies of correctional officers identified by Union President Brian Englert, there are approximately 103 staff vacancies at ACJ. Mayor Peduto called for a task force to address the crisis in police-community relations. And it was very effective in developing action-oriented recommendations in a short time frame. Why can't our county executive call for a task force to be formed regarding the staffing crisis? People are dying at an alarming rate at ACJ. I want to talk about exit interviews. At the December 2020 meeting, this jail oversight board passed the following motion by a vote of 6-1 with 1 abstention. Quote, for the jail oversight board to conduct post-employment interviews with Allegheny County jail employees determined by the jail oversight board. Much of the discussion that preceded this vote was concerning the value of exit interviews and the board's need to become aware of why so many people were leaving employment at ACJ. Board member Judge Lazara stated at this meeting, I think it, and she was referring to exit interviews, should not just be high-level officials, because we're going to hear things differently from people that are lower on the totem pole than people that are higher. Board member Abbas Kamara recommended that we could create a rotating subcommittee of this body to do these interviews. At the last December jail oversight board meeting, Judge Clark recommended that the board conduct an exit interview with Deanne Kulzer, former director of treatment at ACJ. She terminated her employment in November after only working 3 months. It's my understanding the director of mental health position is still open. Recognizing the strategic importance of this position of the director of mental health, has this exit interview of Deanne been done? If not, why not? Has the board conducted any exit interviews besides the interview with Janet Bunce and Michael Barfield since the motion passed in December 2020? If not, the residents at the jail, their families, and the staff at ACJ lose confidence with the board when the board fails to follow through with something they say they are going to do. We cannot afford to lose any more staff. Assessing why people are leaving employment at ACJ is not guesswork. A comprehensive strategy and implementation are needed to conduct exit interviews with many of the staff who are leaving. Staff in administration, correctional officers, medical and mental health staff. This is always best practice when an organization is experiencing a staffing crisis. To help facilitate this process, Warden Harper could provide to the board in a timely manner the name of every staff member who is resigning. The board then could decide of who and how often the board will conduct exit interviews. Regarding board limitations on time, because that has been talked about, it seems the liaison or a third party could have training and assist in this function of conducting exit interviews.
If I may, I'm sorry to interrupt, Mr. Kostinowicz, but you're coming up on your last 90 seconds, so I just want to give you a heads up.
90 seconds?
Yeah, well, it's 10 minutes.
Is it? Okay.
Absolutely.
All right. Okay, well, let me just summarize real quick.
Fair enough.
So, staff retention survey, I sent the board, a statement regarding that. So I think you're aware of my ideas about that. The marketing strategy, and then the financial measures I mentioned last time. I just want to say that according to a recent article in Public Source, the ACJ's budget increased by $12 million in 2022, yet the jail has a dramatic decrease in staff. 64 correctional officers left their job in 2021. $9 million was paid in overtime. So in conclusion, the staff at ACJ are working an excessive amount of forced overtime. Their families are suffering, as are the residents of the jail. The board's legacy will be remembered for years to come regarding what action the board takes in these next few months. Thank you.
Thank you, Mr. Kostinowicz. The next person that signed up was Brian Englert. And again, Mr. Englert, I would remind you that we're limiting our remarks to 10 minutes. Thank you.
Good evening. I want to thank John for all of his hard work and trying to understand our plight. Before I go through my list, I do have a few people I want to thank. First, I want to thank Amy Kroll. Listen, if you don't know who this lady is, give her all the money. Give her all the money. I'm being serious. Give her all the money. I mean, I've been there 11 years. We have the same programs. They're the same programs. We're not doing coding. We got these young kids that grew up on Minecraft, and we don't have any kind of skill-based training for them to go in the world and not be a criminal. No coding academy, nothing. Amy Kroll, I'm her best salesperson. I've sent so many people to Thinking for a Change, I should get a commission. I mean, it's a great class. Amy, I think you raise your hand if I'm wrong. Don't all my people complete that class? I send you winners. My people know the expectations I have of them, and Amy is one of the biggest assets we have, and she's being underutilized. I mean, I just have to say that. I really do. I respect her so much. Anytime I need something from her to help one of my guys, Amy's there. She's there so quick, I don't even know she's there. She just appears and she helps, and she's really undervalued in my opinion. I also want to thank a couple people. I want to thank my officers, first of all, because we're really going through a crisis is not even the word anymore. I'm tired of coming up here and talking about staffing. I see other jails doing so much more to recruit, retention bonuses, hiring bonuses. I mean, this is something council should take up. Pass a resolution to get some money to retain people. I'm losing new officers, and I can't get new officers. Cuyahoga County Jail meets the same demographics as Allegheny County Jail. Same amount of beds, same amount of officers, same pay. They need officers too. They're advertising all over Facebook. And it's not a virtual job fair. It's come work at our jail. Who cares about a virtual job fair? When you look at jobs on the Allegheny County website and you select jail, correctional officer appears on the front page. When you go to the county website, though, you'll see a banner that we need lifeguards. Do we need lifeguards or do we need correction officers? I mean, I think we need both, but one is more important than the other. One's a temporary job, and one's a job that's sorely needed right now. But county PR, they're too worried. I guess they're too worried about dealing with me and what I tweet out or something. I want to thank my public relations firm, Nick Danger Public Relations. They do a great job of handling my social media when I can't do it.
Mic away. Push the mic back.
Sorry. I'm a little worked up today because I'm upset. I want to talk about my staffing issues. You know, we have 28 officers that have a year in, and they have over 1,700 hours of overtime worked in the last month. Over 1,700 hours of overtime. That's 70 hours every month. That's 10% of the overall overtime for the month of 14,500 hours. They're getting crushed. I just lost an officer. He resigned. He said, I'm not getting enough time with my fiance. It's causing issues in my relationship. I'm forced every day. I have officers my seniority saying the same thing. they're getting crushed. So as far as staffing goes, John talked about medical staffing. I mean, John, you don't need to worry about that. We have sergeants and captains clearing people at the door medically, so we're good right there for now. One of the other things I want to talk about medical staffing is whenever we do have an emergency and my officers have to respond and we're performing life-saving measures, right after that, they go right back to their post. I mean, that's a traumatic incident. And they're going right back to their post to work. There's no kind of downtime, no kind of go outside and get a breath of fresh air, nothing. My officers are going through a lot of stress. I have an officer, Officer Bond, who is the legal guardian of his grandfather, a Vietnam vet. He has nobody else in his family to take care of him. While we have staff members that go out and get a cigarette break every day, all he wants to do is go down and be able to call and check on his grandfather because he has to pay for a caregiver to take care of him. He can't even go do that. That's killing morale in my building. We're not treated like people that are vital to corrections. And that's why we're having trouble retaining people. When you can't even be allowed to go make a phone call to check on your loved ones during your own lunch. It's not like you're beating them on time. We also had one officer fired, a brand new officer, because he didn't pass gun qualification training. We have over 100 officers gun qualified. Okay, he's a cadet. He didn't pass his training. He's going to go on maybe one hospital run in his first year. That's 0.3% of his overall work hours. So we're willing to fire a body that's sorely needed because he's not gun trained? He failed the shooting test? That's just ridiculous. Officers with 1 year or less were forced to work 40% of their whole work schedule in overtime. That's a lot. I think the job fair thing needs to be addressed. We're also having trouble with uniforms. I brought this up. I had one of my board members bring it up to the warden today. Our vendor can't get uniforms. The old vendor has uniforms in stock. I secured a piggyback contract with CoStars. I just need Steve or the warden to sign it. I'm still waiting 6 months on shirts. I mean, I lost 60 pounds. I'm wearing a 2X shirt. It doesn't fit. That's a danger. Any kind of loose uniform, if somebody grabs me, that's a danger for me and it's a danger for my officers. If one of you could just talk about signing this form so we can get the uniforms, that would be great. Speaking about jobs, I believe I created 2 jobs myself. I think the jail hired a PR person because of me, and I think they promoted an officer to major just to deal with me. Every time I come here to talk about safety issues, now I'm getting disciplined for being union business late. I mean, I don't care about being disciplined if I have to come here and talk about my officers. And I believe that's against labor laws. Coming up in Easter, the week of Easter, we're on max vacation. So we're going to have 50 officers on vacation. 25 of those officers work the morning shift. We're going to be starting CRU training again. We're going to be pulling 6 to 8 officers off the morning shift for CRU training. We're already short-staffed 6 to 8 posts a day on the morning shift. That's dangerous. And now these 6 to 8 officers won't be able to be forced to work overtime. That's going to be killing my officers. And the most dangerous level in the jail is not lockdown when we have one person in the hallway. That's also dangerous. That max week of Easter is going to be bad. It's really going to be bad. Officers are worried about a lot of things, and that's one of them. In terms of recruiting, I mean, I understand why the county's not reaching out to the Metropolitan Police Chiefs Association. Hey, we need correctional officers. Can you post this on your council bulletin board or website? I mean, I don't believe enough is being done. I'm rambling on a little bit. I'm off track because I only got 4 hours of sleep from overtime. But we need to also work on a few other things. One of the things that I'm really concerned about, again, and I think this is going to make the jail happy, is our email communications. I mean, we just don't have them. They took them away from our phones. And we're the only department in the county that doesn't have access. And like I explained in my PCNC interview, this is critical. I work with the same officer every day on the morning shift, the best officer in the jail, Officer Hamovitz. We can't communicate about what's going on our pod. That's dangerous. We cannot communicate safety issues. That's dangerous. I mean, we're the only department in the county that doesn't have access to our email remotely. That's just crazy. I believe all this is...
One second, that would be an incorrect statement. So that's an incorrect statement.
I reclaim my time, sir.
Yeah, please do.
I believe this is all union busting. I mean, union busting, the definition is interfere, restrain, or coerce employees against union activity. I'm being disciplined for union business about talking about these things. I emailed Dr. Brinkman about Suboxone Pass, and I got disciplined for harassing her. That's her job. I'm not speaking as an officer. I'm speaking as the president of the union when I ask her a question, and she's my equal. I'm not her subordinate. She has no rank over me when I ask her a question for the safety of my officers and the inmates that we supervise. You guys might not be happy about all this, but guess what? My people aren't happy either. And when my people are happy, you guys will be happy. I mean, I just want you to know one thing. It's never over, and I never lose because I never quit. I'll be here every month talking about safety issues. I need officers in this building. I need you to get me officers. I need you to make the schedule better. I need you to get us defensive tactics training for 360 people before we train 15 people for CRU. That's not helping anybody. And I'm available for any questions anytime if anybody wants to ask. A lot of the officers, it's bad. I've never seen so many, hey, you're out of sick time notices as I have this year. People just they can't bring themselves to come to work because it's too stressful. I mean, you have a bad environment. And my inmates, I mean, they know we're doing a great job. Things are getting better. It's getting better. I agree. But these things for us need to be changed. And if you guys disagree with it, that's fine. I mean, this is my job and I have to do it, but you know, we need help. And the easiest thing to do would be to sign that uniform form. I mean, we can't even get socks or boots or gloves. This is crazy.
Thank you, Mr. Engler. All right.
Can I ask a quick question? Who signs that? Is that something we can do?
No, you can't sign that.
I'll talk to you afterwards. He's misguided in some of his information.
You can't sign that.
Well, I just wanted to understand the ask. Was the ask that we sign something, that we vote to approve something? I just wanted to understand what you were looking.
What it is, Ms. Alves, we have a contract with the vendor, PPS. And they were good, but now we have to make an appointment to get uniforms. That's 3 weeks out. Then we get there, they don't have the uniforms. The county building guards can go to PPS or Northeastern. I went to the director of purchasing and I explained our plight to Mr. Alessio. He said, we can give you a CoStar's piggyback contract so you could go to either place. What do I need to do? I fill it out? And he said, okay, you just need to get the warden to sign off on it. I have my steward bring it up today.
Okay.
I didn't get a chance to follow up with him, but this is something that would make our jobs just a little bit easier. We don't have time to drive all over Pittsburgh to get a uniform. They have uniforms in stock.
That's what I was wondering, is the warden that is not signing off on
We
it?
already have a contract with them anyways.
Okay.
I need the director sign.
All right, we're over to 10
Thank
minutes.
you very
Thank you,
much.
sir. We now will hear from Tanisha Long. Again, ma'am, I'd ask that you limit your remarks to 10 minutes, please.
Thank you. So I wanted to speak on a few things, and I hope I don't get interrupted like Mr. Englert was. So first, I would like to thank you for giving me the time to speak here.
Sure.
I wasn't able to last meeting because of rules. I find that a little weird because it seems that we're being selective with the rules we enforce, who can have a designee, who can legally have a designee, and it seems like some things are rules, some things are laws, and we are selective in when we enforce them. So I would ask for a little bit more understanding next time when we're taking public comments, because those are the most important comments we're going to hear. These are the people who have family members in the jail. These are people who may have been incarcerated. These are not the people who are sitting on a jail oversight board. You guys are here to listen to us. On that same vein of listening to us, I would just like to note the face making and stuff like that when people are talking. It's impolite and rude. You know who you are. And I would like to start with attendance. It's hard to be invested in the well-being of people in the jail when you are not attending jail oversight board meetings. I see the same faces every time I'm here, every time I'm watching online. Those faces are never Rich Fitzgerald. We have other members who miss like more than half of the meetings. You're voting on things without a lack of continuity because a lot of times you're just reading notes. I would ask that we treat this not as just an appointed position, but as a job about people that we care about. I think that's what's getting lost here, and I think a lot of times we are just checking the boxes, and there's a lack of investment. When I say lack of investment, one of the reasons I say that is because there's really, in all reality, one or two people who ask questions on this board. When the warden says things like, we are complying with the referendum, no one questions it. I could not walk into my job and just say, I'm doing my job, and no one checks up on it, no one questions it, and no one looks into it, or we hear that we'll talk about it in an executive session. There's no transparency for the public. We don't know what's going on, and it's not like he's gonna give us answers. So that is the job you guys have. The reason that this is so upsetting and the reason that this brings me to this level of anger is because people are dying. People are sick, people are dying. We have people who are losing their legs in the jail. We have, apparently we have officers acting as medical personnel. That's interesting because I doubt any of them are trained medical personnel. We have reached the point where I can list off 13 people who have passed away in this jail in 2 years. That's upsetting. I asked the board, have any of you reached out to their families? Have any of you spoken with people who have expressed concerns in getting medical records? Have any of you followed up with family members who are frustrated that they are not notified when their family member is critically ill or even dead right away? 5 hours, that's a long time for someone to be in the hospital and nobody knows. That's not acceptable to me, and I don't understand how it's acceptable to anyone else. Clayton McCrary, he should still have a leg. Richard Lenhart should still be alive. Robert Blake should still be alive. Cody Still should still be alive. John Brady should still be alive. Daniel Pastoric, Martin Busek, Robert Harper, Binkley Harris, Justin Brady, Paul Allen, Roger Millspaw, Paul Spisak, and Gerald. Another comment that was made at a meeting was sometimes people don't get their medicines on time. I'm not sure what reality we live in where that's an acceptable situation. A lot of medicines run on time constraints. I'm on a medicine that if I don't get it in time, I'm going to face consequences. So for it to just be the answer and it's hardly questioned, that's a problem. And I understand there's a staffing issue, but that's also a problem. And it's a problem that needs solved. And it's not a problem we should roll our eyes at. And it's not a problem that we should just keep kicking down the road. Like, I've heard about the staffing issue for 3 meetings in 3 months. That's ridiculous. At this point, it's safe to say that, I have no confidence in the warden's ability to keep people at the jail alive, and not just alive, but healthy and safe. It's not just about leaving there alive, it's the state you leave there in. It's the state you live there in. And I think these are things that we don't have the luxury of ignoring. And when I say ignoring, I mean just taking it up for 10 seconds, accepting like half-built answers, and then moving on to the next question. When it comes to things like the solitary confinement referendum, just saying we are complying, these are people, these are mental health issues, these are physical health issues, these are people dying. This isn't acceptable. So I guess my ask of council is start showing up, start asking questions, stop sending illegal designees, maybe hold your county executive accountable for showing up to the meetings. I ran into this man at a political mixer and told him that I looked forward to seeing him at this meeting, and he said, probably not. Do you realize the amount of arrogance it takes to say that I'm probably not going to show up to my job that I make over $100,000 a year to do and send some guy to just be there for me who doesn't have the same level of investment that I should? It's ridiculous, and it's ridiculous that that has become the standard. So I would ask you to ask your fellow board members to show up. I would ask you to hold this man accountable for the way that people are getting sick, dying, and hurt. And I would ask us all to care a little bit more and maybe get in touch with some of these families who have legitimate concerns about the people that they have sent in who haven't come out. That's all.
Thank you so much. Thank you for your comments, ma'am. Now, we've gotten a large number of public comments that were submitted in writing. And just so we're clear on the process, people need to be here and sign up on the sheet before 4 o'clock to speak in person. And people need to email their comments prior. Yes.
I have a question about that. I didn't mean to interrupt the monologue. I just had a question about it. So, right, our meeting started at 4 o'clock. It's hard enough for the board members to get here. We're expecting the public, who board members can show up late, but members of the public can't show up late. So we are precluding an entire population of people who either have to pick kids up from school, who aren't off their jobs yet. I mean, even if you work a regular 9 to 5 job, you can't get here in time for the start of the meeting, but maybe you can get here in time for the start of public comments. So do you think that maybe we could either A, move public comments to later, or B, allow people to, anytime they show up before the end of public comment, sign up, or C, both?
public comments are at the beginning of the agenda, where they have, actually.
They haven't always been there. You moved them.
I did not move them.
They were usually at the end of the meeting.
Never moved public comments. Public comments are at the middle of the agenda. People are given a window. I made an announcement today to give everyone a last opportunity. If you're unable to make it here before the cutoff for public to speak in person, you always have the option submitting your public comments online.
But it won't be read.
So with that being said, I'm now going to summarize the public comments which were submitted. So there was a public comment submitted regarding 13 deaths occurring in the jail since 2020, pure humanitarian conditions for those that are held in the jail, poor working conditions for jail workers. And there was a concern, which pretty much echoed the sentiments of Mr. Englert and Ms. Long regarding the board taking the initiative to be more invested in the jail and the operations of the jail. There were an additional number of public comments. One, it dealt with Gerald Thomas. He died on March 6th. He was 26 years old. He was injured at the jail. His family didn't know what happened. His own mother wasn't allowed to see her son's body. There's just a concern that the medical examiner is biased and not necessarily doing an unbiased, unbiased job, just basically working for the person and the people in the community versus working for the different people who work in the county. And there's a concern about people not being informed about health issues pertaining to their loved ones. Similarly, there was another comment that dealt with deaths in the jail, people not being notified, incarcerated relatives are not informed that their incarcerated people are not, their relatives are not informed that they were critically ill or had died. There are also issues with people obtaining medical records despite having legal documentation. And, just the whole process for people becoming informed when people are injured or ill in the jail, and the lack of information is disseminated to the family members and loved ones. I don't know if anyone from the jail wanted to comment on any of those.
I do, Your Honor. Of course, I cannot respond to specific incidents that happened in the jail, but when medical emergencies take place in our facility, our employees provide life-saving measures until healthcare staff arrive to the scene. All deaths are investigated by the county police. All individuals that enter our facility, they are required to let us know who they want us to contact for emergencies. And that is the only people that we can contact, is who the incarcerated individual has notated for us to notify. So we can't notify anybody but the emergency contact. We respect the wishes of our incarcerated individuals when it comes to who they want us to notify for emergency situations. Now, for individuals that would like to get medical information for an incarcerated individual, they have to sign a release of information form. And once that release of information form is signed, then we will give that medical documentation to anybody that the incarcerated individual would like for the medical documentation to go to. But my healthcare staff and all my employees do a wonderful and superior job in maintaining, healthcare services at our jail. Your Honor, that's all I have.
Yes, Ms. Hallam.
Yeah, I have a question about that. So first of all, if someone is deceased or incapacitated, they cannot they cannot sign a release. So if they didn't sign it when they were incarcerated, when they entered incarceration, is there ever any other time that they can have the opportunity to say, hey, if something happens to me, or hey, I'm sick and I'm not trusting this system, can I put this person for you to call if something happens? Is there another instance aside from intake where they can designate the person to get that information?
No, ma'am.
Okay, and then second of all, you tell us after, just in the past 2 years alone, we've had 13 people die, okay, in the jail, or after going to the hospital from the jail. You keep telling us that there's county police investigations, but we never hear about it again. The person, loses their life, you tell us there's an investigation, and the results of that investigation, any information on the cause of death that was revealed, never comes back to the jail. Oftentimes, you don't even bring up in the meeting a person who lost their life in the jail since the last meeting. So what I'm wondering is, what do we need to do to make sure that that information is freely flowing from you and your administration to the members of the board who are responsible for conducting oversight?
Well, you know, Ms. Howland, my thing is this. We're not going to sit up here in an open forum and respond to what the police investigations are because litigation is taking place. So I will talk to my law department as to how to go about getting this information to the board, but I'm going to consult with the law department about that last question.
Is there pending litigation on every of those 13 deaths?
Probably yes. I'm pretty sure it is, yes.
Okay, so prior to that litigation being filed, why didn't we receive any of that information?
Ms. Howland, I'm going to talk to the law department about that, and I'll get back with you, okay?
Okay, yeah, I'm just asking for what is the process that you outline that is acceptable to you for us as board members to get follow-up on deaths in the jail?
I don't think that the board should get anything until I have it cleared from the police, and I'm not going to do it in a public forum. And if there's any litigation, I'm not going to talk about it at all.
Great to hear. Thanks so much.
So, any other questions? So with that being said, another comment, there were additional comments about people, you know, the health of the incarcerated individuals in the jail, medical attention. I think you spoke, your comments addressed those additional remarks. But there was another comment that dealt with incarcerated people in the Women's Acute Mental Health Pod have reported that they're being denied rec or that the recreation time is being restricted based upon the severity of their illness, mental illness. There's just a concern regarding the classification of the incarcerated individual's mental health condition, how you determine the restriction time, and what those ranges are for people that are handcuffed. When people are being handcuffed to a table, being denied or limited recreation time, if you could just, I guess, if you're inclined to speak to those concerns.
Absolutely. Incarcerated individuals living on mental health pods are designated a tier, which has been approved by a provider, a medical provider. And the providers determine what tiers these individuals are on. Individuals that's on tier 4 and 5, they do not get any type of recreation for their safety. Tiers 1 to 3, they do get out of cell time. So that is a process that we put in place, and the medical provider, the doctor, makes that determination.
Yes, Ms. Howland.
Do people without a mental health diagnosis, are they also classified into tiers in the jail?
Individuals on our mental health pod are designated a tier.
So even if you're not in a mental health pod, but you have a mental health diagnosis of some sort in your medical history, are you not classified into any tier?
The providers have made a determination that if an individual is in general population, then they are cleared from the tier process. When they come to a mental health pod, they are designated a tier.
Okay, and does that tier fluctuate with, you know?
That's the provider makes that determination, ma'am.
So I know that they make it, but does it ever change? Like if someone's a tier 3, do they ever get bumped up to a tier 4? Do they get bumped down?
After the provider evaluates the individual, yes, ma'am.
Right, but are there multiple evaluations throughout their stay?
The provider will have to make that determination. And I'm sure that there is multiple evaluations, but I'm not the expert in that. I leave that up to the provider to make that determination.
Gotcha, and who is the provider?
AHN.
Okay, do you think maybe you could bring them to the next meeting so we could chat about this a little more?
I don't know about that. We will see.
Okay, well, I am making an official request. Can you please try to bring your contact from AHN to the next board meeting?
I will look into that.
Thank you very much.
Yes, Ms. Moss.
And this is not, the question I have is about the.
Please turn your mic on, ma'am.
I thought it did. It's not.
You did it. You were just too far.
Oh, okay. About the medication dissemination, and that has always been something that I've been concerned about, because we get a lot of questions. I have gotten a lot of questions about that. So could you explain to us, Warden, just how that's done? Because there are medications, like the young lady was saying that spoke here a few minutes ago. There are some medications that have to be taken at a certain time.
It's unfortunate.
And there's, you know, and that's very important. But I don't know, I know that we have been short of staff, but how, could you tell us how this is all done in a daily manner for for medication for the residents?
As I stated before, everybody is trying to recruit LPNs and RNs to, be employed at their facility. We are in the medical mecca of the world, where Pittsburgh has many of hospitals that's paying $15,000, $10,000 bonuses, and of course, healthcare staff is going to these entities. As I stated before, medications have been delivered late. We do everything in our power to try to get it to them on time, but as I stated, we are trying to recruit LPNs and nurses.
But nobody ever misses their
ma'am.
medication.
No, ma'am. And I've said that several times. No, ma'am, nobody misses medications.
Yes, Ms. Howland.
Just going off the answer to that question and the answer to the previous question about the mental health tiers, are you not worried about any sort of lack of ADA compliance with, getting meds off time? I know one of the public commenters spoke about, I take medication myself. I have to take it at certain times during the day or else it's not as effective. That's as prescribed by a medical provider. Are you worried about that, and also the categorizations of people on the mental health pod as being not in compliance with the ADA?
Well, ma'am, I don't know exactly what the ADA says, so I'm not going to respond to that till I can actually read exactly what it says. So I'll get back to you on that answer at the next meeting.
Is there someone in your facility who does deal with ADA compliance?
We have somebody in the county that deals with ADA compliance.
But not specifically at the jail?
Not specifically at the jail.
Okay, and what is the position in the county who deals with that?
I'm not sure about that. I will get that to you at the next meeting.
But there's a person?
Yes, ma'am.
Okay, thank you.
So, consistent with Ms. Moss's comments, as well as some of the speakers, there were a number of comments regarding medication and medication being disseminated to the incarcerated individuals in a timely manner. So I believe the warden has responded to that. Ms. Moss has also addressed that. So with that being said, there was another comment that dealt with the referendum. There are a few questions about the referendum's medical exception. How many days can an incarcerated person be kept in solitary confinement based on healthcare professionals finding that confinement is necessary for medical reasons or to ensure the safety of others? How often does this occur? Is there an appeal process? What's the average length that an incarcerated person is kept in solitary confinement? And what's the longest duration an incarcerated person has been held for these reasons?
So who sent that request?
That was Janet Jones.
Janet Jones. All right, the decision will be made by the healthcare provider. The healthcare provider makes the determination how often the assessment is to take place. There is no appeal process, but the incarcerated individual can discuss with the healthcare provider. We have no data on the average length an inmate is kept into segregation due to healthcare reasons, and we do not have any data on the longest duration an incarcerated individual has been held in segregation for healthcare reasons. So that's my response.
Ms. Allen.
Yeah, I just have a quick question. I know we skipped over it in the agenda about the compliance with the referendum, and so I know it's a messy agenda, but it was on there under old business. But
Wait, actually, it's not on the agenda, so that's a misstatement. It's not on the agenda.
It is.
No, it's not on my agenda.
It's the second bullet point under old business. I mean, this was the agenda that was sitting here when I got in.
Go ahead.
But anyway, sorry, I didn't mean to highlight that as much as I meant is this when I should be asking my questions about the referendum, or should I?
It's your questions.
Okay, fantastic. So since it was brought up, I have a couple questions. So I saw the most recent report that was posted online as per the language of the referendum, and I actually passed out before the meeting, each and every board member should have a copy of the language of the referendum in front of them. And Warden Harper, do you want to see a copy to help you with my questioning?
No, ma'am.
Should I give it to your legal counsel, Mr. Bacharach? Do you want to see the language of the referendum to help you? Okay, so if you do want it, I have one here for you. So the only thing you wrote in this report this month was the whole facility was on lockdown the entire month. Is that correct?
We were on modified lockdown, yes, ma'am.
Right, the entire facility. Okay, but so no individuals, no pods, which you can't do anyways, but the entire facility for the entire month of March was on lockdown.
On modified lockdown, yes, ma'am.
Okay, so now I want to, again, if you want the language, I have it here for you, but I'm going to reference subsection A, where it says what the exceptions are. A facility-wide lockdown is an exception to the solitary confinement ban. It says that if you determine a facility-wide lockdown is required to ensure the safety of persons held in the facility, then no ban on it. But you must document specific reasons why any lockdown is necessary for more than 24 hours and why less restrictive interventions are insufficient to accomplish the facility's safety goals, okay? Very clear in the referendum. But I read the report and I didn't see specific reasons why the lockdown was necessary, especially not for the entire month, the entire jail. And also what less restrictive interventions you tried to do but were insufficient to accomplishing your safety goals. Again, month after month after month, these very specific requirements in the language of the referendum are omitted from your report, just completely ignored. And so I'm wondering, specifically for this month, since there's not much else to talk about because you only put one thing on the whole report, can you explain why less restrictive measures were insufficient and why the lockdown was necessary? Because only one COVID case in the month, and it was at the very end of the month. I'm just wondering, what is your rationale here?
Okay, I'm gonna answer the question, okay?
Yeah.
So, the report specifically says that the jail's on a modified lockdown. In accordance to the referendum, anybody that's not getting 4 hours of out of cell time has to be on the report. So therefore, the whole jail did not receive 4 hours of out of cell time, so that they were on the report. And it specifically says medical reasons is why. So initially, at the beginning of the month, we were having issues with COVID. So we did try other strategies, and we moved it from 10 to 15 inmates being out of cell to split recreation, where there's 20 to 30 inmates being coming out. But they still weren't getting the 4 hours of out of cell time. So I do not agree with everything that you said, and I've answered your question.
But you haven't, because it says specific reasons. Medical is not a specific reason. If I say I need somebody to help me with medical, what's the first question? Well, what kind of medical help do you need? So
I stand by my answer, ma'am.
okay, and then you also understand that this, if a person is in their cell with another person in their lockdown, that still counts as solitary confinement. You understand, and if you want, again, to read the language, it says nothing about someone having to be alone in their cell without getting the 4 hours of rec.
I think I've said this before. The report reflects an individual in a cell by themselves.
I understand that, and that's why I'm bringing this to you, because that's not what the referendum says. The referendum, not once on here does it say by themselves, does it say alone in a cell, not once does it say anything about a person being in a cell by themselves. So I'm wondering why you are stuck on that point.
I have nothing else to say about that, ma'am.
But you need to answer me, and I'm wondering why you're not following the language of the referendum, and that's the answer I'm looking for.
I'm following the letter of the referendum. The referendum says an inmate, singular, in the cell. Singular,
Doesn't
not
say
plural.
singular anywhere on here.
Do you see plural S behind the inmates on the document?
Just
look at the document.
Right, it's talking about no one person can ever be held in solitary confinement. It doesn't say it means that they have to be by themselves for it to be solitary.
Well,
that's a really weird interpretation of this referendum, Warden.
Well, my answer is the same. Individuals in a cell by themselves will be counted as being segregated.
And can you tell me where in the referendum it says that those are the only folks that you should count? Because that's what we're talking about, is the language of the law. You do not have the authority to interpret a law how you see fit. That's what judges are for.
Come on.
And I'm just asking for an answer, Warden. I'm not trying to push you. I really just want a very simple answer.
I've answered the question.
You haven't. You've said that the law says something it does not.
I think the best way that we can resolve that is that we can talk with her legal department for advisement on the interpretation.
Yes, I appreciate you giving your input on that, because we've asked for that for multiple months now at multiple meetings where we've said, if you think you're complying with the referendum, but the language doesn't align with what you're saying, get a legal opinion and present it to us. And it has never once happened, despite somebody from the legal department being here at multiple meetings. So what needs to change in order for us to get that?
We will look into that, ma'am.
You will look into getting a legal opinion?
Talking to our law department.
Okay, and why have you not done that at previous meetings where you have said that's what you were going to do?
Ms. Hallam, at this point.
I mean, Judge Halsey, I ask the same questions every month and I'm sick of it.
and they said they're going to consult with their attorney, and they're going to try to get you an opinion regarding the referendum.
And they said that in February, and they said that in January, and it has never happened. All I want is them to not be allowed to sit here and tell us lies and interpret laws. That's all I'm asking for. I do not think that that is very much. I'm not asking for policy changes. I'm not asking for special privileges for anyone. I truly just want answers.
Understand. So
Can we, as a board, ask for a legal opinion on whether the warden and his administration are following the language of the referendum that we all have in front of us? Because I don't know about everyone else. You have it in front of you. Am I missing something? Am I the only person that sees that the report on the solitary confinement ban that is given to us every month does not follow the letter of the law? It seems very clear. Can we ask for that as a board?
Sure, you can ask for that as a board.
Okay. Does anyone on the board have, do we have
Is that
any
something we
lawyers
can make a
here?
motion on?
Yes, I would like to make,
That is not proper. You can't do that. So we can talk about that in between the next meeting, but you can't make.
why is it improper?
Because it's not reflected in the agenda. You can't do that.
Doesn't need to be. I can add something to the agenda that's not on it before the meeting starts. As per Robert's rules, I can.
Not a motion.
With a supermajority of the votes of the members of this board, I absolutely can add something to
So
the
it's
agenda.
something that we will discuss as a board, and we.
I would like to make a motion to have the jail present us with a legal report at the May meeting on whether or not they believe that the warden's monthly reports are in compliance with the language of the referendum. And I would like to ask any of my colleagues for a second on that.
I'd like to second that motion.
So we have a motion and a second. May we please vote? I am not trying to be disrespectful. I am just
you
so
kinda
frustrated.
are,
I am not. I'm following the rules and no one else
really
is.
are, because it's not on the agenda. You can't raise a motion from.
Yes, you absolutely can. I'm on a legislative body where we do it. Absolutely we can.
So again, we will address this.
We have a motion and a second, Judge Halsey. We have to vote.
I've already said that I was going to talk to the legal department and bring it to the next meeting. I've already said that.
You've said that at previous meetings, though. I'm trying to make sure that we have something on the paperwork to ensure you comply.
Okay.
I'm sorry that I cannot take your word for that anymore. You've told me that before.
Okay.
Can we have a vote?
All in favor?
All right. Supermajority.
There's also a public comment regarding, along the same lines, regarding the belief that there are weapons still being used in the jail that are in violation of the referendum, and that people are being assaulted with these weapons, and it's a huge liability for the county, and it is unacceptable, and there have been lawsuits that have been filed, and it's just a general statement that that's something that needs to be addressed, and so that's consistent with the discussion that was just had. There's a comment regarding staffing issues with Warden Harper and the television show. I guess you were on a TV show where there was a discussion about staffing issues. Consistent with the comments that were made by Mr. Englert and some of the other people that spoke, there's a concern about staffing issues and a concern about the steps that you might be taking to address those staffing issues. Is that something?
So I'm not going to get into the specific of any staffing issue at the jail, but we are going to talk about what efforts we're taking in Chief Beeson's report to recruit. So we will be talking about that a little bit later, Your Honor.
All right. Yes.
Yeah, I just would like, I would like to ask some specific issues on staffing questions, because it seems like a lot of the things that are being brought up by public commenters, both in person and online, have a lot to do with staffing issues. And so I just want to know, what are your top 3 staffing medical needs? What are the top 3 things that could help improve the condition of the jail in regards to staffing, particularly medical staffing?
And since they intend to give a report about staffing, does it make sense to ask those questions at that time?
Yeah, I could, but I thought he said that it was going to be about the promotion of the open jobs, not the staffing needs.
When they bring up.
Okay, I'll ask you that later, so maybe we can think about it for a little bit until then. Thank you.
So there's a comment regarding the gift packs in the jail and the fact that people are not able to buy gift packs anymore. Is there anything you'd like to say regarding that?
We are in the process of doing an RFP for the commissary services, so that should be coming out pretty soon. And until then, there will be no gift packages until the contract has been awarded to the vendor.
Yes.
I know it was brought up at a previous meeting last year that this was potentially going to happen, an RFP for a new commissary provider, and you had said that you would keep us in the loop in that process. So has the RFP already went out, and if so, can we get a copy of it?
It has not gone out yet. I've asked you guys to submit what your suggestions and recommendations were, and nobody sent me anything.
So you want us to send it prior to even seeing what you intend to send out?
No, what I asked you guys to do months ago was anything that you considered needed to be in the RFP. I asked you guys to email me your suggestions, and nobody sent me anything.
I didn't realize, I mean, I can't speak for everyone. I didn't realize you wanted it first. I thought we were going to kind of work on it together, but I will absolutely get you that.
It's already done now, ma'am.
Okay, so then can you send us a copy of it if it's already done?
I'll see if I can do that. I'll let you know at the next meeting.
Warden Harper, I would just really ask that before that next meeting, you also read Title 61, which authorizes this jail oversight board. It's the state statute that allows this board to exist and gives us our unique oversight authority, because you really can't just say, I'll think about giving you documents. Very clearly, again, in the legislation, it says what we are allowed to have access to, what you need to provide us. So can I just ask, so that we don't get into this again next month, that you look at that before the next meeting?
I think I said that, ma'am.
Okay, thank you very much. You said that?
I did.
That you were going to read the statute?
I said that I'm going to see if I can get that RFP to you.
Oh, no, I know, but I'm specifically asking if you could read the statute that authorizes the Jail Oversight Board, Title 61. I just want to ask that you read that so that you know, it's not I'll see if I can do it. It's like the Oversight Board asked, I will do.
Well, I've already read the statute, Ms. Powell.
Okay, so then you know that is in there.
That's why I said what I said. So I'll see if I can get it to you, ma'am.
Okay.
So there have been a number of comments regarding the food, saying that the food is not compliant with nutritional standards. There's a question as to whether or not a dietitian has assessed the menu. Does anyone check the menu on a daily basis, weekly basis, monthly basis? There was also a concern about rodents existing in the kitchen and different areas of the jail, and that nothing is being done to remediate that situation. And so I don't know if you could speak to any issues regarding food.
Our food provider provides 3,200 calories a day for our incarcerated population, and the food vendor's dietitian ensures the nutritional requirements. The ACJ is exterminated twice a week, and our health department has conducted inspections of the kitchen, and deficiencies have been abated.
Ms. Hallam?
Yeah. So I worked at a bunch of restaurants in my past, right? And so, the things from the report, live rodents, droppings, animal rodent droppings in food, cockroaches, all in the food preparation area, that's not something that just happens and you can't avoid it. So I'm wondering, do we need a new pest control person? Do we need more frequent service? What is it that we can do to make sure that we're not getting health code violations for the food we're serving in the jail?
Well, as I stated, Ms. Hallam, we got the report, and the issues that was brought to our attention has been abated.
So it's never going to happen again? You're never going to get violations?
We work in a 1 million square foot facility, so absolutely I cannot say that would never happen again. We serve over 8,000 meals a day to over 1,500 individuals, so no, I can never say that.
Okay, so then we're not sure that the problem's solved, we're just hoping.
We're going to do everything in our power to make sure that it's reduced as much as we can.
Okay, and what about providing menus? The way we post the Jail Oversight Board information, meeting minutes, agenda, stuff like that on the website. Can you also post a monthly menu so folks, families know what to expect they're going to be eating in the jail, so we can be sure that the food that is on the menu is what they're being served?
Well, we said that many Jail Oversight Board meetings ago that we do it weekly, and guess what? I looked today and was on there.
But that's the problem, is the menus that you're posting is not the same as the food that I'm seeing and hearing about people being served. So I'm looking for very specific menus that are actually what they're getting served, not just we could serve this week.
Well, Ms. Hallam, my thing is this. Everybody's experiencing supply demand, and sometimes there's going to be changes in the menus because you can't get what you really want to get because items not being able to come in.
Okay, so then any time that there's a deviation from the menu, can you report it to the Oversight Board?
We'll look into that.
Thanks.
So,
I'd like to say.
Yes, Ms. Moss.
To the fact about the rodents and I'm sorry. I forget.
far away.
I think I'm talking to you. Concerning the rodents and the different things that was in that comment. I did visit I did visit the kitchen. I went through the storage, where the food is kept, and I thought it was done very well. And nobody knew I was coming to do that. But I do know that we do sit on a river. You know, we sit where you will get rodents, but any restaurant or anywhere you go, that's one of the things that I believe people fight. Keeping it clean and keeping different rodents, roaches, or whatever out of the. But they even had put down plaques or planks so that the flour and sugar and those things are not on the ground, on the floor. They're sitting up on racks. I was pretty impressed, and I went through the whole area. I went in the storeroom. I went all through the kitchen. I was there while they were getting ready to make dinner, and they had big kettles to make mashed potatoes. And so I, for the good of something, saying something good sometimes, I thought it was kept up very well.
Thank you for your comments.
And can I just say something, Your Honor? Ms. Hallam, Ms. Klein, also, Mr. Plarski also toured the jail, and Ms. Hallam and Ms. Klein also ate the food, and they didn't see any rodents or roaches, et cetera, during their visit. So I want to thank you very much for reminding me that board members have toured our kitchen and did not see what has been reported.
I'm going to say I really did enjoy my chicken patty when I was in there. I'm not going to lie about it. You know, after not eating it for 5 years, it was just a blast from the past. But this isn't like some random person coming in. I'm not a health inspector. I don't work for the health department. I'm looking around. I'll eat the food. I'm looking for whatever any jail oversight board member hopefully is looking for. This isn't like just some rumor. The health department was there and issued 16 violations and detailed these violations in their report. So it's not a question about, oh, this doesn't happen, I didn't see it. It's in the report. It's very clear. And as different, to Ms. Moss's point, because I totally appreciate your point, I didn't see that stuff when I was there either. I'm not disputing that whatsoever. Ms. Klein was with me. We did not see it. The health department did.
I didn't eat.
Right.
I wasn't there to eat. I just went to, stopped in to inspect. But when was this report?
This was from February 26th of this year. 16 health code violations.
There in December.
So I think the biggest difference here is if there is a restaurant that gets health code violations, you can choose not to go there. The people who are incarcerated in the jail, no matter what, they have to eat this food and they have to deal with the quality of food that's being served. And I think that's kind of what we're trying to improve.
No, I don't think anything wrong with improvement, but I just wanted to say that, and I asked questions about the storage. I asked questions about the storage and how, like sugar and things that do draw ants and bugs and how they were stored. I looked at all of that. And I was there by myself. But, I just know that when you're dealing with food in a place this large and you have to prepare food and you're going to get something, it's just how it's maintained when you're getting it, I believe. That's just my comment.
Last two comments. There was a young lady that indicated that she was in the jail and she was in the processing unit and she was assaulted by an inmate. She was not released until after midnight, in the middle of the night, despite asking to be released in a timely fashion. That did not occur until after midnight, and that she saw people wrapped in trash bags while detoxing, and that she was refused medical attention on a number of occasions. And I don't know if that's something you'd like to address.
The wonderful thing about the Allegheny County jails, we have cameras all over the facility, and a video review was done today, and all the allegations made in that comment are not true. And we've saved the video in case people would like to see it.
Did you look at do you have any information regarding this allegation?
They were not
investigation.
Oh, they were not true. I apologize.
We did a video review, and none of the allegations are true, and we saved the footage on video.
All right. Any questions regarding that? Lastly, there is a concern about people in the jail are unable to get books, mystery books, nonfiction books, books authored by African-American authors, and there's just a concern about the lack of specificity regarding titles of books which are banned, books which are permitted, the types of books, and it is presenting an inconvenience for the family members when they attempt to purchase books for their loved ones in the jail.
So, Your Honor, on our website, under frequently asked questions, we have criteria as to how to send books. We do not ban any mystery books, nonfiction books, or African-American books, but we will not accept books that we feel as though it's going to be a safety and security issue, or books that have nudity, et cetera, et cetera. So it's on the website as to what the criteria is under frequently asked questions.
Yes.
Yeah, so my understanding from talking to folks who have also expressed similar complaints, I mean, even my own parents had trouble getting me every time they tried to send me books when I was in there. So I know it's been a problem for a while, not just recent and not just because of COVID and nothing like that, is that how does the purchaser know whether or not it conforms to your outlines of, what was it, safety, security, nudity? How do they know that whenever they're purchasing the book? Are there specific titles that you know have these things in them and need to be banned?
As I stated before, under frequently asked questions is the criteria that a person can look at the website and follow.
Yeah, I've seen that frequently asked questions. It tells you how, what providers to order from, how it's going to make sure it gets there, make sure it doesn't have these sorts of things in it. But are there specific books, like how do you know that those books have it in there? Do you have a list of the books, hey, these are the ones that we've identified have controversial topics?
Well, I think what we can do, Ms. Hallam, is we can actually state on the website, nudity can't be sent to the jail. Weapons and stuff like that, or how to build bombs, we can put stuff like that on the website so people can know. So we can do that.
Yeah, but I mean, it's more than just that. This person, from my interpretation, the people I've talked to who have been having these problems, it's not like they're trying to send porn magazines or how to build a bomb books. These are just regular, often fiction books that are being banned from entering the facility.
My employees would not turn away books if it complied with our policy. So what we will do, as I stated, we will indicate what type of books cannot come in, such as nudity, building weapons, bombs, etc. We will put that on the website so that everybody is clear.
Okay, so if nudity is discussed in the book, no pictures, it's just discussed, sex, nudity, does that mean that that book is not allowed in the facility?
If we have a front cover that's showing things that should not be shown, it's not going to be allowed in the facility.
Right, I'm not talking about images, I'm talking about literature, like the words.
Images, and if there's any graphic language in there where it can arouse somebody, we're not going to allow that type of books into our facility, because that leads to other things, Ms. Howell.
Okay, all I'm trying to do is help people from you having to reject books all the time, get some work off your plate, and just try to make a clear outline for people. This is what you can buy, and this is what you can't. Because I've sent books to people without having read them before. I don't know if there's a cuss word in there. I don't know if there's a sex scene in there. They ask for a book, and I send it to them. So maybe we could work together on more clear outlines.
I think I just stated that we will put some guidelines on the website, Ms.
Okay, I hope it helps. Thank you.
Yes, ma'am.
So a clarification for me, if a loved one sends books, they will get inspected by someone at your facility before they're disseminated?
Yes, ma'am.
Can I alley-oop on that? You have a list of books that you have turned away in the past?
I will have to check on that.
Yeah, I think that would be a helpful start. Hey, we already know that all these books we're going to turn away for whatever those reasons are, just so people can go through their process of elimination. Okay, this book isn't on this list, I can send it. I think that would be a really helpful step.
Anything else? Anything else? All right, we will now have the warden's report.
Okay, Your Honor. We're excited about moving the agency to some type of normalcy. Ms. Crow and Ms. Batterton stated that we've incorporated in-person reentry services and educational services. We've also implemented in-person chaplaincy services where the individuals can go down to our chaplains department to receive religious services. We've also increased the amount of individuals allowed out of cell time from 10 to 15 inmates to split recreation. And split recreation means that a tier comes out for a certain time period, and then that tier goes back in, then the other tier comes back out. We are looking forward to moving to full recreation on May the 1st. We're looking at moving to full recreation. We're excited that we started in-person social visits, and we've increased the amount of social visits from 30 minutes to 1 hour, and we've extended social visits to the evening shift till 7 p.m. Also, we would like to advise the Jail Oversight Board that Correctional Employees Week will start May the 2nd through May the 6th. So correctional professionals throughout the world will be celebrating our profession. And finally, the jail has conducted exit interviews for the last 2 years. We ask employees who resign or retire to sit for an interview. If they do not, an exit interview letter is mailed to their home. Unfortunately, most do not participate in the process. Over the last 2 years, 119 employees have retired or resigned, with about 17% completing the exit interviews. The most common reason provided were they received a better opportunity, they're furthering their education, overtime, or work hours, and COVID-19 concerns. So, Your Honor, that's all I have for the Warden's report at this time.
Ms. Klein.
Thank you, and I'm so pleased that visitation has resumed at the jail. But I was curious when I read that there was 0 visitations for the juveniles.
We allow visitation for the juveniles, ma'am.
Well, what I read in the report was that there were 0 visits recorded with the juveniles.
The juveniles get visitation, ma'am. We'll look at that report.
Okay.
Ms. Howell.
I have a couple questions. Thanks. Okay, so the first thing, I'll just work backwards since you ended with exit interviews. So, and I think this goes to a public commenter from early too. So we, as a board, we had known that you have been doing exit interviews, but if you remember a few months ago, I have no track of time, but we had decided that we as a board think it would be helpful if we did exit interviews to get a different perspective, right? I know if I leave a job, I'm not gonna tell my boss the same things I'm gonna tell my boss's boss. So, we had conducted maybe 4, I don't know, Terry, do you know how many we conducted? 4 or 5, Gail, and you know? Yeah.
But I never really, I think we stopped somewhere. I'm sorry, pardon me. But I thought when we were looking to get the liaison, we kind of like slowed down with the process.
I think so too.
Yeah, because we were looking to have that would have been a part of what the liaison would have done.
Yeah, and I know one of our hangups was it's hard for us to get in touch with the former employees. So I was wondering if for purposes of our own exit interviews that we have said that we're going to conduct, if there's some way that you can connect us, you know, with this person's leaving the jail, here's their contact info on their way out, or maybe you let them check a box on the letter you sent them that said, I agree to my contact information being sent to the Jail Oversight Board members to conduct their own exit interview. I don't know about everyone else. I think that would be very helpful because that was our single biggest hang up, was figuring out how, I mean, we were using the Google and the Facebook and all of that to try to figure out where these people were to talk to them. So the ones we did get in contact with, we got a lot of great valuable information, but I agree that it shouldn't just be the director level positions. It should be, you know, corrections officers and an LPN, and especially with the medical staff and correctional staff vacancies, we should really be focusing on those people. So do you think that that's something that you could do?
That's something we'll look into, ma'am.
Okay. You have a lot to look into this month, Warden Harper. Hope you're ready.
That's every month, Ms. Howell.
All right, thank you.
Do you have another quick comment?
Oh, crap, I do have a lot of more comments for the Warden's report. My bad. Okay. Another thing, so I know that you're doing the CRU training. I don't know if you mentioned it or if that was at the last meeting. And so I just had a question about who is training. I know it's only a segregated group of officers who gets the CRU training, right? It's not everyone in the jail.
Correct.
Correct, okay. So who trains that group? Is it you? Is it?
We have a staff member at our jail that's training the correctional officers.
And what is that person's position? Like,
A major.
a what?
A major.
A major. So a major does the training. And then what sort of like certifications do they have? They have like firearms munition certifications. They have first aid certifications. Do they have mental health de-escalation trainings? What kind of certifications are required for someone to be the trainer for that sort of training?
They do have certifications, and that's something that I will not talk about in this forum.
Okay, and why can't you talk about the trainer's qualifications in this form? That's kind of what this form is for.
We can talk about it in executive session, man.
I know, but like, listen, I was almost on board with this whole, like, there are certain things that need to be talked about in executive session until you went on the news talking about stuff that you told us we would only talk about in executive session, like staffing. And so now every time you say that, to me, it just kind of sounds like I don't want to answer your question in this meeting and not, I can't.
Do you have a question?
Yes. Why won't you answer a question about the certifications that your trainer holds or one of your employees holds, especially someone such as a major?
Because I feel as though that all the certifications that they have could jeopardize the safety and security of the facility, telling the public everything that this person is certified in. So that's something I'm not comfortable with, and I'm willing to talk to the board in an executive session.
I mean, if anything, wouldn't it instill confidence in your trainer if we knew that they had all of these certifications?
I will tell the board in the executive session, man.
Okay, when is that executive session that you're referencing?
You guys let me know.
Okay. Okay, we'll establish that. Perfect. Okay, awesome. So next, okay, my next question is about intake. And this actually might be my last question for you, believe it or not. I have gotten, and I don't really even think that this is very new, but definitely, at least in the last few months, I've been hearing about it a lot more, about captains and sergeants doing medical assessments and intake. So it used to be that no one went upstairs without seeing a nurse or some sort of medical profession to be assessed, correct? There's that little room in the back by the vending machines you go into and you talk to some sort of medical professional. And so, is every single person that comes through the jail seeing a medical professional when they come professional at intake?
Yes.
Okay, and are only medical professionals, not captains, not sergeants, not any sort of officers, the ones doing the medical assessment that comes in at intake?
Only healthcare does a medical assessment.
Okay, so no medical questions whatsoever are being asked by anyone to incarcerated individuals by anyone other than a medical professional?
The medical assessment is done by healthcare.
Okay, but
period.
And there's no other medical questions asked at intake outside of that assessment?
No, ma'am.
Okay. It's just weird because I've been hearing that a lot, is that, because I know that there's periods of time where there's no medical in intake, correct?
I'm not going to discuss staffing issues in this forum, Ms. Howell.
But Warren Harper, you talked about it on the news now. You can't just go back.
I never talked about any staffing issues except for recruiting efforts at that news conference.
You talked about a very drastic lack in adequate staffing at the jail. I mean, I watched it. Trust me, I watched it multiple times. I really enjoyed the segment. But I just wonder why you talk about it there, but not with us.
I stated at the media event that I spoke about the same things that I talked to this board about.
Okay, and so never is there a minute in time that intake does not have a medical professional there?
I'm not going to talk about that in this forum, Ms. Howell.
Okay, can you talk about if there are dividers placed between folks who are being assessed when they come in through intake to make sure that their medical confidentiality is kept?
We have put that in place in accordance to the NCCHC recommendations. That's been in place for a couple of years, or a year or so.
And it's there today and it's never not there, the dividers?
It's stationary, you can't move it.
Okay, and so they were not removed. And then also, what about when it comes to medication, whether it's in intake or in any of the floors? Is there ever non-medical professionals administering medication?
Only medical professionals administer medications.
In every situation?
Every situation.
Gotcha. Thank you so much.
You're welcome.
Any additional questions? All right. Thank you, Warden. Chief Deputy Warden Beeson.
Thank you again, Your Honor. I'd like to start out my report by announcing recent promotions since the last Oversight Board. Renee Madden was promoted to the Deputy Health Service Administrator position, David Gallagher to Sergeant, Josh Newlett to Captain, and Gerald Crum to Captain. So we pass on our congratulations to those individuals. Next, I'd like to provide an update on our current cadet class. So the current cadet class consists of 6 cadets. They are scheduled to graduate next Thursday, April 14th, and they will be on schedule available on Sunday, April 17th. The next cadet class begins on April 25th. That consists of 11 corrections officers candidates. And then our next scheduled physical agility test is scheduled for May 19th, 20th, and 21st. I don't have numbers as we're still compiling those through current applications. Is there any questions on those numbers before I move on to the hiring initiatives?
Ms. Moss.
For the next cadet class, Ms. Moss?
Yeah, for the next.
April 25th. And that was 11 cadets.
Okay.
I do have a question. How long is that class?
9 weeks.
9 weeks. 9 weeks of training?
Yes, sir.
All right. Ms. Allen?
No, I'm waiting for the next one. That's what I have.
Oh,
No more questions? Okay.
no more questions.
So there have been a number of questions and comments today of great interest in what the jail is doing in regards to staffing and recruitment. So I thought providing some information on those efforts done in conjunction with human resources, marketing, and other partners would be helpful. Human resources and marketing continue to have robust advertising of positions, which include posts on LinkedIn, Facebook, Indeed, and other social platforms. Additionally, there has been digital and radio advertising across a number of platforms. The biggest success has been in using Indeed. Over the last 4 months, there have been over 5,000 views of jail-specific jobs. And the dedicated URL, which is joinacj.com, has seen nearly 27,000 page views in the last 2 years. For medical positions at the jail, there has also been a referral bonus. Additionally, we work with our healthcare provider, the Allegheny Health Network, and other vendors and contract agencies to find RNs, LPNs, CNAs, among other positions. We do this in cooperation with the Kane hospitals as we share similar needs. The jail is part of the county's virtual career fair that's being held next Wednesday, April 13th, from 11 a.m. to 1 p.m. and again from 5 p.m. until 7 p.m. And there's more information and registration links available at AlleghenyCounty.vfairs.com. An application fee of $41 was implemented to ensure that applicants have some seriousness in pursuing this opportunity. All applicants can apply for a fee waiver, and any individuals that have applied for a fee waiver have received one. Human Resources has used hiring models that include and don't include application fees with no resulting difference in the applications received and individuals who are being onboarded. A recent change to the testing process allows for applicants for correctional officer positions to be onboarded more quickly. In the past, testing for that position would be done in person and would only be offered at certain times of the year. Now the testing process can be done online, which allows for more on-demand testing, moving applications forward, therefore prospective employees through the process again more quickly. Pay for individuals at the ACJ when they start their training to become corrections officers is $22 an hour. That pay rate continues when they are sworn in as corrections officers. They are then eligible for increases following a probation period and see a substantial jump in their salary after the first year. Within a few years, officers can be making substantial salaries pursuant to their contract and remain some of the highest paid corrections officers in the region. Corrections officers start with 5 weeks and 3 days of vacation and can earn a maximum of 41 days off. They are also permitted to use 20 buddy days or a shift exchange every 6 months to switch a scheduled shift with another employee so that they may have more flexibility in their schedule. In mid-2020, the county began reimbursing all employees at the jail for parking, and that continues today.
Ms. Allen?
Questions?
Yeah, this is actually the first time I ever knew about that $41 application fee. Is that ever returned to the applicant?
No.
So whether they're hired or not hired, they never get that 41 bucks back?
Correct.
What do you do with the $41? Like, where does it go? Does it go into a certain fund? Does it fund something in the jail? Does it go back into the county's general fund? What does the $41 go to, maybe?
I believe the $41 goes to the company. There's a the company that does the test online. It doesn't go to the county. The county doesn't receive that money.
Gotcha, like we never take it and disperse it even, it goes straight to them.
But there is a waiver, and so far, I mean, everybody who's applied for the waiver has received the waiver. That's all through the company that we contract with that does the test. The county doesn't get any of that money.
Thank you for clarifying that. And then my only other question about the staffing is the same question I asked earlier. Like if you could snap your fingers and have anything, whether it's 3 positions filled, maybe a department fully staffed, what are the top 3 staffing needs that you have? Is it positions? Is it?
I mean, we could always use corrections officers, so if you know anybody, please encourage them to apply.
Oh, I do tell my friends. I'm not lying. I do tell my friends to go apply for jobs at the jail, especially when they release those reports about how much money they make working in the jail. I tell them all. But that's only one. You have to get 2 more.
Well, there's lots at the jail, Ms. Hallam. We're always looking for healthcare staffing. As the warden stated earlier, there's onboarding initiatives everywhere in the county, in the state, in the country. So to get particular positions to come to Allegheny County Jail is difficult.
But are there any specific positions that you feel like if we could fill this, I'd feel a lot better about it?
Nothing specific. I mean, hiring in general is paramount in our efforts right now.
Okay, all right, thank you for that.
Any additional questions? All right, I believe now we'll hear from Dr. Brinkman.
I'll always give you people that I want to hire.
Yeah, please.
We need everybody. Everybody's a cog in the wheel to make the wheel work. However, nursing positions, broadly speaking, I've got a lot of specialties. People who work in the capacity of case managers and social workers for behavioral health and therapists, those are my top ones. But, like I said, I need everybody to make the system work.
Thank you.
But not that that is any more or less important than anybody else in the facility. Just wanted that to be clear. So regarding infection and testing rates this past month for COVID, the numbers on the Allegheny County Jail website have been updated. 543 incarcerated individuals have received a PCR viral diagnostic test for COVID-19. Of those, 481 or 12% have been found to be positive throughout the duration of the pandemic. There's 1 incarcerated individual presently positive in the facility. And today's institutional count, which I prepared last night, was 1,541. We have had 4,051 or 89% negative PCR tests. We have 0 pending tests. We have 0 incarcerated individuals hospitalized from COVID-19 at this present time. We've continued the utilization of surveillance testing to mitigate disease spread within the institution at the most high-risk points of concern as advised by local, state, and national authorities. From March 1st through March 31st, 1,251 rapid antigen tests were offered with 1,240 negative, which is 99%, and 3 positive, which is 0.2%. In total, since April 12th of 2021, when we began rapid antigen testing, we've offered 28,715 rapid antigen tests with 28,704 negatives, 951 positives, and 730 refused. We have a total of 958 positive cases since the first diagnosed case of an incarcerated individual on April 6th, 2020. For vaccination, since our facility became an authorized vaccine provider, we have vaccination clinics on site continuously. We're extremely grateful for incarcerated individuals who elect to receive a COVID-19 vaccine, especially with the presence of other variants and the rising cases we had seen leading up till this point. Additionally, we have the capacity to provide booster vaccines in compliance with recommendations from the CDC. We continue the process of booster vaccinations for staff and incarcerated individuals. Of the incarcerated individuals in total thus far, we have supported the vaccination of over 2,542 incarcerated individuals and provided over 473 booster vaccine doses. On site, we still have Pfizer, Moderna, and Janssen vaccines. We are continuously offering the vaccines, and interest and consent to the vaccine has significantly increased this month, which anecdotally I would attribute to the ability to have social visits at this point. So last month we reported 672 individuals receiving their full series. This month we have 802, which is 52% incarcerated individuals, which is up 7% from last month. So combined, the whole COVID picture, our positivity rate this month is the lowest it's been over the past year, being 0.2%. For the month of March, and we also have the highest vaccination rate to date with 52%. The CDC has recently changed reporting requirements of COVID testing to provide that for facilities to provide to them that the only positive rapid antigen results will be reported. As a result of our own COVID-19 reporting requirements and and information will change. You'll see those changes to the information posted on our website beginning this Friday. Our testing practices and policies are not changing, just falling in line with CDC recommendations regarding the detail of reporting. So I think that helps to give a whole picture of, I know there's been some criticism of how long it's taken for us to be able to change operations, but these rates really discuss and paint the picture that we've been making the right decisions for such a large facility to be able to find a sense of normalcy. Any questions on COVID?
Ms. Allen? Ms. Clown? Ms. Allen? Ms. Clown?
Just a quickie. Do juveniles have to have vaccinations in order to get visits?
No, they don't, but they also require parental consent to get the vaccination. So I think that's why we made that concession.
That would be interesting to include in the visit, maybe while they're there to.
Absolutely.
Ms. Allen?
Yeah, I'm just wondering, and I love, that is the highest vaccination rate we heard, so that's great. I'm wondering, like, what was the thought process behind mandating vaccines for visits to resume for the incarcerated individuals? I understand the folks coming in from the outside, but I mean, unless something has changed, right, you're visiting, there is no contact with anyone other than who you're normally in contact with, right, the folks on your pod. You're sitting on a phone in a pane of glass, and your visitor's like on the other pane of glass. So I'm just wondering if it was like what the rationale was, or if it was more just like, hey, we're gonna reinstitute visits, let's use this as an incentive to get them vaccinated.
I don't want to speak out of turn, but tell me if I'm wrong. It was a joint discussion across administration to find the safest way while continuing some mitigation efforts. We've seen a lot of partners throughout the community and across the state in corrections choose different things than we've chosen. And I think that conservative option that we have chosen speaks to the rates that we see also. So it's just about trying to be as focused on the safety as possible.
I understand, thank you.
Mm-hmm.
Any additional questions?
For medications for opioid use disorder and the expansion of those efforts, we do continue to provide the medication-assisted treatment for opioid use disorder and alcoholism by offering naltrexone, Vivitrol for the treatment of alcohol or opiate use disorder, and then Suboxone and Sublocade for opiate use disorder. In March, we had 25 individuals prescribed naltrexone, which is the oral version of Vivitrol. One being released to the community who received their Vivitrol shot. During the month of March, 87 were treated with Suboxone and 11 were treated with Sublocade. During the month, 98 unique individuals were prescribed buprenorphine and continued with their medication. We've continued to continued contract expansion. Sorry, I wrote it in a really weird way. For methadone treatment with Tediso, which is the methadone provider in the community that we'll be working with, and are actively developing the implementation procedures for the methadone services to expand beyond the pregnant females that we would be treating currently, and have developed a process flow chart for the program and continue discussing staffing responsibilities and recruitment.
Ms. Allen?
Have there been any new prescriptions, like folks who didn't come in with a MAT prescription that you put on for methadone or any of the other?
No, we have not begun inducting anybody.
Okay, thank you.
Any other questions? Ms. Clark?
I just want to say I'm so pleased with your vaccination result.
I was giddy last night too when I calculated it, so I appreciate that.
I just have a question, and do you track the demographics of the people that you are providing medication-assisted treatment to?
We hadn't been.
I mean, you think it might be worth, I don't know why, but it might be better to have it
Yeah,
and not need it, and need it and not have it.
Well, it's not that we don't collect the information, it's just that we've never computed it because we would have that information on everybody.
Might make sense, I don't know, it's just a thought. Yes.
Can I just add, like, when do you think you'll start putting, what did you call it, induction? Is that what it's called when you start someone on meds? Yeah, when do you expect, like, that process to start for MAT?
I don't have an anticipated date right now. We really wanted to make sure that all of these programs that we had very solid foundations before we went to the place where we would be completely evaluating somebody cold turkey, not cold turkey, but from the get-go to determine what the most appropriate treatments are, because it really does require a lot of evaluation for the dosing and things like that.
Yeah, I'm really excited for that to happen, so can you just let us know whenever it's on in the horizon? Okay,
That
awesome.
would be, yes.
Thank you so much.
Ms. Moss?
But this isn't about the vaccination, but is there a number, or, because I was looking through all the information, of how many youth under 18 that we're housing now? Because the last, we hadn't heard.
See it on the dashboard.
Pardon me? I did, yeah,
I believe this morning was 17, Ms. Moss, but I might be off by one.
How many?
16, I believe.
What?
7.
Less than what we had, because the report that we heard, I think in December, was it when Judge Clark gave the report on the youth?
What?
I think we had like 28.
We were over 20 at some point.
Yeah.
And they had either aged out
So now
or
there's
the
17.
charges were dropped,
17.
yes.
Okay, thank you.
Any additional questions, Mr. Urbanko? Yes, ma'am.
Based off of Ms. Moss's question, I actually like that. What happens, like on your 18th birthday, you just get put down in general population? Is that how that works? Is it literally like, is that how they age out? They turn 18 and go straight downstairs that day?
Once they turn 18, yes, they're classified to the next housing unit.
Okay, thank you.
But what we also do with the individuals that turn 18, we just don't put them down in a general housing unit. We normally try to put them in a program, et cetera, so that they can get some of the programming that they need.
All right, yes.
Last thing I had to report on was Torrance commitments. So in March, we had 10 persons admitted and transferred to Torrance State Hospital. 10 new persons were committed during the month, and currently we're awaiting 11 that are on the wait list for Torrance State Hospital. While the longest has been waiting since April, we finally do have an admission date this month. So incredibly hopeful for that.
Any questions? Ms. Klein, no? You're the healthcare professional, so.
1 year is an awfully long time to wait.
It's a kind understatement.
Ms. Allen?
Yeah, if we're doing like all the medical questions, I do have one. So, I'm sure that you saw there was recently an article about someone losing a limb in the jail, and I'm just wondering, like, how many times has that happened before? That, because I assume you don't do amputations yourself, right? You're sending them out to hospitals. Is there a number on like how many times that's happened, whether in the past 5-10 years, that someone's had to have a limb amputated while incarcerated at the jail?
I definitely don't have that at my fingertips.
Okay, do you think that is documented somewhere that you could bring that to the next meeting?
I could make the attempt. The only reason I say attempt is because we've changed over healthcare management 3 times in the last 10 to 12 years. So we don't have all of the old records to go back very far.
Even if it could just be since this new provider, if that's an easier data point to get, that would be very helpful. Thank you.
Any additional questions? All right. Thank you very much, ma'am. Ms. Howell?
I have a motion. I would like to request money from the Incarcerated Individual Welfare Fund be put on the joint tablet commissary accounts of each person incarcerated at the ACJ. At the time of me drafting this motion, there were 1,550 folks currently incarcerated in the jail. At $100 for each person, it would be a total cost from the IIWF of $155,000. I would like to make the motion to approve.
I second.
All in favor?
Aye.
Aye.
Any opposed? Motion carries. I think we're at that place, Chief.
I have something else for new business.
Aw, Jack, premature.
Mr. Urbanko.
Yeah, I wanted to discuss the attendance at meetings. Currently, we have Acting Controller Tracy Royston watching the meeting. I was wondering if it was possible if we could discuss a virtual option, a limited virtual option for some board members to attend the meeting. I know County Council has, what is it, Bethany, 2?
We get 2
Board members could have 2 meetings where they can attend virtually. I think it would help attendance. I know there's a lot of stuff going on. COVID has shown us that we could do this stuff virtually. I think it would help participation. Is that something we can make a motion on? Do we have to go to executive session?
Actually, Mr. Urbanko, I don't know if you're aware, Ms. Royston knows that we discussed this by way of a meeting via email.
Okay.
And everyone was given an opportunity, except for Ms. Klein, to weigh in on that initiative. Although there were a number of people who were in favor of that, the consensus was that we needed to be present, given our obligation to the public. So thus far, the vote has been made offline. There's been a discussion and a vote, and the consensus of the board was that everyone should appear in person. If that's something that, I don't know that we need to discuss any further because we've already discussed it consistent with Ms. Royston's request. So to that end, I'd say there won't be a motion, and it's already been addressed.
Can I add in? Mr. Urbanko, do you mind? I just don't want to
I always defer to you.
Okay,
Ms.
thank you. I'll just add to that because I think that's a great idea, and I actually think it's the opposite. It doesn't decrease participation. It allows it. For example, I could not be here last month because I was speaking at a conference out of town, but I could have participated in the 2-hour block of the meeting by phone or by Teams. Again, on County Council, you get 2 a year. I actually think it increases participation for folks who whether are traveling or they're experiencing COVID symptoms and don't want to put the rest of us at risk. Whatever it is, I think it does the opposite and it actually increases participation if we allow it. Again, limited, because otherwise we'll have people who are just calling in by phone every single meeting and never showing up. But I think that it's better than having no one here or having someone send a designee that is not allowed as per the statute. So I'll second that motion if you're making that motion right now.
It's actually not a motion.
I think it was.
No, actually, it's not. And we've already discussed it, and you had an opportunity to say everything that you said today when we spoke.
Yes.
As did Ms. Royston and everyone else. So the matter has been addressed. So now, Chief.
Wait, we can't vote.
I'd like to make a motion to adjourn.
Anyone like to second that motion?
I second.
Anyone opposed? All in favor? Thank you, Chief.